We'll get started here in just a minute, folks.
Yeah, it's just about 8 o'clock, so we're just gonna let people filter in a little bit.
We'll get started here in just a minute, folks.
Keep your hand on your gun.
Yeah,
Don't you trust
it's just about 8
anyone?
o'clock, so we're just gonna let people filter in a little bit.
There's just one kind of man that you can trust. That's a dead man or a gringo like me.
Yeah,
Be the first one to fire. Every man is a liar. There's just one kind of man who tells the truth. That's a dead man. Oh.
Gary and that group, that would be fantastic. We'd really appreciate it.
So who else do we have here? Texas Slim. Welcome to Problematic Policies, everybody. We're just getting started here. Still getting a few folks up. We were just listening to A Gringo Like Me, Ennio Morricone from The Duel in Texas. we listen to a lot of this spaghetti western music from back in those 50s and 60s, cowboy movies and stuff like that. So that's where that comes from, and that's the spirit that we're bringing to this part of the world here.
John Wayne is still my favorite actor, so I like to watch old Western movies.
Oh, I'm gonna
Absolutely.
have to wrestle you for Clint Eastwood. Clint Eastwood's my favorite.
Yep, yep. And he went out, he had to go all the way out to Italy to make a lot of those movies because people in the States didn't want to make them, right? So that's where a lot of those early westerns came from. And, you know, it feels like we're in a bit of the
What
same
about
moment
Lee
here,
Van
right?
Cleef? What about Lee Van Cleef? He's
Lee
my
Van
favorite.
Cleese,
Oh,
100
Cleef.
Acres Ranch.
What
100
are you
Acres
talking about?
Ranch. This is a cattle rancher, and he's got this giant Bitcoin mining facility out there. This guy is really
I'm
on
not
the
a
edge.
cattle rancher. I'm not a cattle rancher, but these guys around me got like 30,000 head running all around. You know what I mean? And they're good people. I mean, I love eating hamburger. I slap the side of the cage, and I'm like, oh, it's a lot of hamburger in there, you know. You
So, as you can see, we're a rowdy bunch here, but we've got some esteemed doctors with us tonight. We've got Dr. Nass, Dr. Lindley, Dr. Griffiths, and soon to be Dr. Hazan. Um, this will be, of course, hosted by Breeauna Sagdal, the senior writer and researcher at the I Am Texas Slim Foundation. And before we get started here, folks, we're going to just remind you guys a couple of times throughout this series. We are in the middle of launching the new IamTexasSlim.org foundation website. It's a 501c3.
so many
Everything,
hamburgers in it. So many
everything we
hamburgers in that
do,
thing.
everything we do here. Who made that guy's speaker? Get back there, 100 Acres. Um, everything we do here is out of pure love, passion, and the spirit of servant leadership and volunteerism. I came into the Beef Initiative as a volunteer. Texas Slim, of course, started the Beef Initiative and tirelessly continues the Beef Initiative. He came into this, of course, as a volunteer. Breeauna was a volunteer. Everybody who's come into this has volunteered and just through their proof of work created their brand and their identity. Breeauna's got hers. She's the policy leader, of course. Texas Slim. All the ranchers have their own brands, and so what we're gonna do is we're gonna brand the world again the way that we used to do it, right? In a pure way, in a way that's community based, in a way that's decentralized through and through, right? From the soil to the code of the websites. So that's what we're about. And thank you all so much for being here with us. Ryan Cooper, I see you down there. Ryan Cooper is the Missouri Beef Initiative and the Milkmen's Alliance, Raw Milk. But anyway, Bree or Texas Slim or Dr. Cat, if you guys want to, or Dr.
Yeah.
Angela.
Yeah, I'll get us started. Thank you so much for the great intro, June. Really appreciate you. And June Roughshod June is our amazing digital. He's the brain behind everything digital, and we're really grateful for all of his graphic design and strategic work. He's just awesome. Thank you, June. So yeah, we're going to launch. First, I wanted to touch on a few issues that we've been addressing within our policy work, and that's the issue of land use. So I just wanted to go through this a little bit and discuss kind of what's going on in terms of land use and water right restrictions across the United States and how that's impacting our herd health as our herds are being consolidated into larger pardon me, into larger and larger populations. And same thing with humanity. So I'll address it from the human side and then I'll kick it over to the doctors because I think this is an important point to touch on, especially as we start talking about protocols and policies for things such as veterinary health and then human health. And then we're going to address some of the One Health initiative issues within the space tonight, and some of the policies that we're seeing on the back end through like the USDA and APHIS, for example, which is the Animal Plant Health Inspection Service, which is soon to be APHIS 15. They're intending to drop the pest portion and just have it be a animal in pretty much surveillance, tracking, tracing mechanism for the USDA and the UN One Health initiative. So and then sort of in addition to that, we'll address some of the H5N1 stuff. So if people have any questions, they're welcome to pop up and ask questions as we kind of go along, and we'll make it like an open forum and also really educational. So break it up a little bit. So it's not too monotonous. But so starting out, I just wanted to address very quickly the concept of the federal plan for equitable long-term recovery and resilience. We cover this in our policy document called America the Titanic. And we make this analogy because we have effectively hit the iceberg, and how this disaster is managed will really determine the future of our nation. And the disaster aspect of this is the economic portion of what we're dealing with. It's not just the fact that we have $8.28 trillion in unfunded pension liabilities, the fact that Social Security is nearing bankruptcy, or that Medicaid will essentially be bankrupt, sans significant reforms, but just the fact that we're facing about a $50 trillion deficit, and we don't have the GDP to even pay our interest payments at this point. We're barely scraping by on our interest payments. So there's been this new sort of concept that was implemented under the Biden administration, initially through executive orders, but implemented essentially by the whole of government, and that's the entire administrative apparatus. And it's this concept of equitable long-term recovery and resilience, which is this sort of overarching theme that involves climate ideas, climate ideology, and some other sort of arbitrary metrics on things like equity, for example, and how that really boils down. What it really means at the end of the day is a loss of local control over land use, zoning, future development, planning, and water rights. And so what we have seen roll out over the last 4 years through this plan has been implemented through contractual obligations through something called the Community Benefit Agreement. And the subversion of local control is the reason why we're seeing, like in Western North Carolina, for example, where they have a statewide strategic buyout plan. This is why we're seeing things like people not being able to rebuild on their own property. Similar with the Coastal Commission or LA County, for example. We are seeing administrative burden that are preventing people from rebuilding. At the same time, we're seeing a prioritization of funds in it's less than 10% of the U.S. landmass, but essentially what it boils down to are these concepts of resilient cities or smart cities. And so there's this idea that we can just relocate Americans into these 15-minute cities that's going to somehow be more resilient to climate change, and we can just stop farming on land. We can start farming vertically and start using insect protein. And I'm not making, I couldn't make this up if I tried. That's frankly, that is what we're seeing in these policy documents. So there's an issue with this, however, which is that anytime you start to consolidate the population, just as consolidating our herds, for example, in the highly concentrated dairies or cattle farming, CAFOs, confined animal feeding operations, for example, we start to see sometimes an increase in illnesses, right? When you start to put populations together. So thinking maybe I could kick it over to the doctors if any of the doctors wanted to touch on this on the human health side, and then we can just kind of go from there on the idea of consolidating populations and how that may impact future health outcomes. If any of the doctors want to kind of touch on that.
Breeauna, yes, this is Meryl. Let me say that what happened is that over the last, I don't know, since the Obama administration anyway, a lot of new concepts were introduced as being important to the federal government. And one of them was biosecurity, and another was resilience. And these are words that can be interpreted in many ways. And how I think they were used is that some, clever lawyer figured out that they could use this sort of positive terminology. We're going to keep you secure. We're going to make you be able to come back from any emergency or problem that arises. You can come back stronger right afterwards. And we're going to do the things to enable that to happen. Well, of course, there really isn't anything that can give you biosecurity, especially if somebody wants to use biological weapons on you. And this idea of resilience, nobody defines it. Just like with One Health, you can't get a definition that makes any sense. How do you make everybody resilient? Well, I would have thought it would not be by blowing up dams and getting rid of reservoirs and having fewer water supplies for cattle, for instance. But anyway, using this kind of terminology and additional terminology about how we need biodiversity, species are going extinct, and so we have to provide them more wild land that they can live on, because it's the humans encroaching on their land that is leading to extinction, which is probably true in some cases, but maybe not all. So we have to do things to enhance, species that are at risk or said to be at risk. Anyway, with these concepts in mind, the government then rolled out policies. And these policies, I don't think, had anything to do with resilience or even biosecurity or biodiversity, but were intended to consolidate power and to basically push small farmers and small ranchers off the land. And so we've seen a variety of policies roll out over, say, the last 10 years. We've now seen, in terms of climate change and improving the ecosystems, we've seen the Biden administration spend billions of dollars to obtain various types of conservation easements on the property of farmers and ranchers, which could potentially, according to Margaret Byfield, who was pretty expert in this, could lead to them actually losing their land, because the government or whoever owns those conservation easements could then tell them how the land could be used and what they're not allowed to do with the land. And we're seeing some of this happen already in Europe more than in the United States. So it's just sort of starting to percolate through to everybody's mind now, that there's something going on where the government is doing something to gain more control of land, is designating more land as national monuments or a conservation area in one way or another, where over time, and all of this stuff is done piece by piece, bit by bit, so you don't really see the whole picture until basically the trap has shut around you. So I think that's what's happening, and I'm trying to give you a bigger picture about what Breeauna was just talking about.
Thank you so much, Meryl. I appreciate that. Yeah, and we're we're already starting to see this, right? Not only does government intervention in the marketplace breed consolidation and monopolization, right? But we're also starting to see these issues within land use and these sort of abstract concept of resilience kind of playing out in policies that end up being less about resilience and more about arbitrary control over sort of the rules of life, if you will. In the state of Oregon, I say that because in the state of Oregon, they are about to spend, I think it's $450 million, if I'm not mistaken, to eradicate one species of owl in order to save another. And so we sort of see this concept playing out across the board, as opposed to what we would consider regenerative or traditional stewardship. But I think, at, when we start talking about things like, the One Health Initiative, or this whole concept of tracking and tracing and surveilling and labeling and, just tagging every aspect of our natural world, I think it becomes problematic for two reasons, right? One is that there's the obvious conflict of interest with the 2013 Supreme Court case, in which nothing of nature can be patented. So there's a real conflict there to begin sort of tampering with nature so that the private sector can become owners, if you will, right? And then there's the other concept that whatever the corporate world cannot own, then the public sector will then manage. And it really does, it's not only a loss of liberty, but it's a loss of our ability to create a GDP at a time when, we are very quickly approaching a $50 trillion deficit. So anyways, so I was thinking, if you guys wanted to touch on or open it up for kind of One Health and maybe launching into some of the H5 stuff, or however you guys would like to proceed with this next. I'm open to ideas on that. Kind of hoping for more of an open discussion. Honestly, at the end of this, I would really like to get to a point where we can talk about better best practices, better protocols, and maybe a call to action for something akin to like a Great Barrington Declaration for how to handle H5. I think it would be great if we could come together between both the veterinary and livestock world and then the human health world, and come up with some ideas and some better guidance concepts to counter certain aspects of the One Health Initiative.
Meryl, do you want to start about One Health?
Sure. Okay. What I thought I might say first is that the resilience and the biodiversity and the conservation is part of another concept that they don't usually say out loud, but occasionally they do, which is that we have to value nature, environments, ecosystems, and animals, and even plants equally as we do humans. And that is a concept embedded in One Health also. So even if humans have to, have a lower income or a lower standard of living, or we have to be moved into cities, that's okay because we need to give the animals more space so that they can have a better quality of life. I mean, that's sort of the concept or the claim that is made to justify things. Now, so One Health, if I can go back to the beginning, is a concept that was sort of invented by a veterinarian because they said, look, we deal with certain animal diseases and human doctors deal with human diseases, and sometimes they spread between animals and people, but we don't talk to each other, and we don't really work together to figure out how to deal best with these diseases or prevent them. And so if we create this concept called One Health to avoid siloing veterinarians and doctors. And then the concept, so this was about 20 years ago. The concept then was expanded and was taken up by United Nations agencies. So the World Health Organization joined with the Food and Agriculture Association, and what was the other one? I don't know why I'm blanking on this. I should know it very well. And then later they picked a fourth organization, the UN Environmental Program, and they called it the Quadripartite. And these organizations sort of ran with One Health. So they created definitions for what One Health is. They created something called the One Health approach. And all these things have such convoluted language explaining them that nobody really understands them. And there was 61 published definitions for One Health. But I think the basic idea, I think the concept behind it, the reason why they've created One Health and are trying and are pushing it out everywhere, is so that the environment, so land, water, people, animals, and plants are all under the jurisdiction of One Health, which will come under the jurisdiction of these UN agencies. And so anyway, what's happened is the United States has spent a fortune, a king's ransom, building out this idea of One Health, telling all the federal agencies they need to embed it in their programs. In fact, today, a federal initiative was rolled out for One Health. I spent an hour being very bored listening to a woman, a veterinarian who works for the CDC, Casey Baravesh, talk about the years they've spent getting this concept into the various agencies and whatnot. But besides that, the federal government has spent billions of dollars creating One Health programs in universities around the United States, but also around the world, and building it into health departments. So basically, while the rest of public health got starved over the last 15, 20 years, One Health was where the money is. So all these public health professionals have been taught, we have to do everything One Health, One Health, One Health. More in Europe, more in the rest of the world. So if you want a grant, if you're a scientist in Brazil or Romania and you want a public health grant, you need to make it sound like it has something to do with One Health. It mixes up animals and humans and the environment. And if you do that, you're much more likely to get your grant. Okay, so anyway, so now we have this, it's sort of like climate change, that people decided climate change was a very good way to get a lot of policies pushed forward that they wouldn't be able to do otherwise. And One Health is the same thing. So it's a false concept. The public health people that are pushing this have never actually been able to show that it's of any use, that it hasn't solved any problems for diseases that transmit between humans and animals. It hasn't really solved environmental problems. But there's still lots of people who are basically being forced financially to insist that they are doing their work in a One Health manner. They're using the One Health approach. Another piece of this is liaison. So One Health is also about people working together. So people working across countries, within a country, within different departments. And they are building out a network of, basically a control network, an alternate form of governance of the environment and of medicine and of, animal health that will be, they're trying to build a very strong framework of how decisions will be made outside of the governance structures we think of as making decisions, the people we voted for making decisions. So they're creating these other alternate structures. Similarly, there are new entities that may be several counties wide or several states wide that are also working and getting federal funds to do this, to fix certain environmental problems. So that kind of alternate governance system is already being set up across the United States. I don't know if that is outside the US. Let me stop there and someone else pick it up.
I just have a quick question for you, Dr. Nass, and any of the other doctors who want to chime in. From my understanding, the first vaccine that was ever created, for example, was created from a strain of cowpox. Is that right?
Well, perhaps it was before. I don't know, Lady Montagu, whoever it was, brought it back to England, and it was actually being used in the Middle East. So it may have been cowpox, but yes, it was for smallpox, as far as we know.
Okay, so that kind of brings me around to my point, which, and I, if I'm not mistaken, I believe we still use like a bovine serum in our vaccines today. It just makes me wonder, if animals can also transmit diseases, right? Can they not also help us to create immunity? I mean, doesn't that seem like a logical sort of question in all of this?
Sure. And in the pre-antibiotic era, horse serum would be injected into people. So you would take a little bit of smallpox or something else, anthrax, for example, injected into a horse, maybe several times, small doses. The horse would make antibodies. You would draw the blood, and if a person was dying from anthrax, you would give them that blood, those antibodies, back in the 1800s and early 1900s. So yes, today we could potentially study in animals what are the best antibodies, what are the best T cells. We could learn a lot by allowing animals to develop immunity and studying them, but instead, of course, we're trying to kill off the chickens so we don't have any immune chickens. But because we've already spent $1.5 billion paying off farmers for 130 million chickens and turkeys and geese and ducks that have been culled in the United States since 2022, government doesn't want to spend that money culling the cows. So they weren't expecting this to hit cows. So they had to come up with a different response. And it turns out, as best we know, because they're keeping the information very quiet, but as best we know, some of the cows get sick for a week or two and then they get better. It sounds like most of them go back to producing the same amount of milk, but some of them do not. Some of them produce less milk, and maybe a couple percent are being culled because they're no longer able to produce milk at the rate they need to. It hasn't been a problem in the beef cows. That the virus, for some reason, particularly likes the udder. And so concentrations of virus in the milk can be very, very high. The media consistently claim that cats are at risk. If cats drink this raw milk or eat cat food that is raw, that may have the virus in it, they may die. Some veterinarians are warning people to keep their cats as indoor cats because God knows they might catch something from a wild bird poop outside. We don't know how many cats have died. It doesn't seem to be a problem for dogs, and it's really not much of a problem for humans. And we still don't have a single person who's gotten sick from drinking raw milk, even though we know that it has been, 75% of the herds in California have had bird flu in the herd, and 70% in Colorado. So we know that there's been a lot of milk that has been contaminated, that has gotten out there to the consumer. Now, the pasteurized milk, yes, that will kill the virus. The raw milk, that's not going to kill the virus. You can probably drink this virus. In most cases, it's going to be okay, possibly because the cows are also producing antibodies. There are other substances in the raw milk that are enabling us to drink it, and not get sick. But in any event, it's not a problem, and yet the media are trying to make it into a problem. And that's very worrying because we don't know what's coming down the pike.
Thank you so much for that. Slim, I saw you had your hand up, and then I was going to ask if Dr. Sabine could tell us about her research, and let's talk about gut health a little bit. Let's bring that aspect into this conversation. And we have Gary here. Gary's also very well versed in the gut and microbiome conversation. So Slim, why don't you go ahead and then we'll kick it over to Dr. Sabine and introduce her.
Yeah, thanks, Breeauna. And I hope everybody can hear me. I'm out on the dirt roads of West Texas tonight talking to ranchers. So thank you for being patient with me earlier. One thing that I wanted to bring up, Dr. Nass said, this one health initiative, it's a global thing. And, I've traveled around the world a year, 1.5 times over the last 2.5 years. And you see it in the marketing of things, you see it in Asia, you see it in Australia. And so, that's why we look at this as we say build out locally and broadcast globally, because it is a global movement. It is a global shift. And, there's asset reallocation coming to America. They've built a lot of ranches and a lot of commodity cattle. Innovation has gone on without anybody understanding that in the United States, and how much beef we ship overseas and how much beef we ship, to into the United States is a form of national security issues at this time. And so, listen to these doctors and tie it into human health, animal health, soil health, water table health, land ownership health, and let's put it all together in a big narrative that people can, really understand. And the policy work and everything that Breeauna does is key on a federal level. We have, Justin Trammell of Farmer Ranch and Freedom Allowance of Panhandle Meats in Canyon, Texas, and he's a board of directors for that association. And it is volunteers, but they have superb, basically, interaction with legislation in the state of Texas, and they have vets. And so, this is a good talking point. The foundation was basically dreamt up and finalized with my relationship with Breeauna. And it's for this because a lot of foundations, a lot of nonprofits are using this One Health initiative across the planet. And it's a lot of debt. It's a lot of fake printed money. And, look at asset reallocation when we're talking about everything, and look at land ownership in the United States. And if we lose our land, then we lose access to a lot of health, a lot of our cultural heritage, and a lot of biology that basically got us here in the first place. So I appreciate y'all. Thank you.
Yeah, thank you so much, Slim. Dr. Hazan, I'm really grateful that you could join us this evening. Excuse me, hold on. Oh, sorry, I had a tickle in my throat. Welcome to the stage. So glad that you're here. I'm really excited to, share with the audience your research, and if you wanted to just kind of give an intro and talk to us about the microbiome and what you guys are seeing on the research side, that would be amazing.
Well, I think we're seeing a lot. For those of you who don't know me, I have a genetic sequencing lab that's spearheading 57 clinical trials on the microbiome and disease. So we've been accumulating stool samples from all over, from Zimbabwe, from China, from Italy, from America, before COVID, during COVID, even now, still going. And basically, we're kind of like trying to map out the microbiome with the diseases to try to see, well, what does the microbiome look like in Parkinson's, in Alzheimer's, in autism, et cetera, and kind of figure out this signature microbiome. My background is gastroenterology. I've been doing fecal transplant as my subspecialty, where I take stools from a healthy donor and put it in an unhealthy that has a condition called C. diff. C. diff, is really what got us to look at the microbiome, because when we started improving patients with C. diff, we started seeing other things improve. And really N of one, N of two, really nothing that we could hang our hats on, but enough to kind of say, hey, there's something going on in the microbiome. My own case of Alzheimer's improved with fecal transplant kind of woke me up to, wait a minute, maybe Alzheimer's is a microbiome alteration. And so I kind of went this route. Prior to that, I was doing clinical trials for pharma and doing GI as a gastroenterologist. It was kind of, a series of events where I was doing clinical trials on the poop pill and realizing, wait, we're in the poop business in pharma and we have no idea what the hell we're doing and why even fecal material works or helps in C. diff. So it was kind of the beginning. What was interesting is what I realized for C. diff is that a lot of people have C. diff in their guts that do not have diarrhea, that are not presenting with problems of C. diff. And so essentially, from that, trying to compare, well, what's different between patients that have C. diff and patients that have C. diff in their guts and it doesn't affect them, and people that have C. diff that have diarrhea and are dying. And one of the big finding is really the diversity. So the loss of diversity, when you start looking at diversity of microbes in someone's gut as we get older, obviously, children is a different story, but as we get older, diversity really represents our exposure to microbes, our ability to go to China and eat a hamburger in China and not get completely sick because we're accumulating some microbes from China, and then going to Japan and getting some microbes from Japan, and developing little by little that resilience, that overaccumulation of microbes in our guts that essentially recognizes other microbes. Immunity starts in the gut. And immunity starts by really recognizing, having microbes in us that recognize other microbes and say, hey, you know what? I don't need to kill the person because I recognize that microbe, right? So when you compare the microbiome and the diversity between, Zimbabwe and the Amazon jungle and the Amish to a New Yorker, to someone that stays in a house that's completely sterile, living in a sterile environment, it's a completely different microbiome. And the diversity is completely different between someone that has been in the forest of the Amazon jungle, exposed to, you know, billions and trillions of microbes, to someone that's been staying in their homes, for, and then tries to go outside. And that's what we saw during the pandemic, right? And the pandemic was really beautiful at waking us up to the need of a solid microbiome to survive COVID, that resilience, to develop that resilience, right? And so the problem is we're following a science that is kind of, in my opinion, a little bit outdated, where we're all about sterilizing. Well, let's clean up the counters, let's put alcohol, let's kill, 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 let's give antibiotics for viruses and all sorts of things. And what we do when we do that is we sterilize, we kill microbes, and we kill maybe the bad microbes, but we also kill the good microbes that are helping us survive. So when you have a person that's basically at home in a sterile environment, and then all of a sudden you put them in the jungle of, Africa, or you put them in the Amazon jungle, essentially, um, they're not going to necessarily do very well because it's a new environment. They don't recognize these microbes. So, and I'll give you a perfect example. I was born in Morocco, and I came to America, to Canada, then to America, and I probably had a very diverse microbiome, right? That could accommodate to the environment of Morocco, right? I come to America, and of course, we're over sterilizing ourselves, and, I've lost a bunch of microbes. And of course, the idea of antibiotics for every little thing and not wanting to suffer and toughen it up, you become, more sterile. And when I went back to Morocco as an older person doing microbiome analysis, I realized I ended up getting E. coli that was toxic, and I realized it's probably because I probably had it as a kid, but I lost it. And somehow here we are. I don't recognize it anymore, and it's affecting me. So I have to do something to 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 suppress that E. coli, essentially. So I think we've gone too far in over sterilizing. And I think in over sterilizing, we are killing our diversity. We are losing microbes that are really important in absorbing sugar, microbes that are really important in absorbing calcium, microbes that are really important in absorbing vitamin B, vitamin K. So if you don't have those microbes, how are you going to absorb sugar? So just to give you an example of why this is alarming to me, and you all, those of you who follow me, you know me. I'm all about the save the biff, save the biff, motto everywhere. I'm all about hashtag save the biff. Biff is for bifidobacteria. It's a crucial microbe that we need, to help us with absorption of sugar. And for immunity, it's present in babies. It disappears as we get older. Our lab showed that it was lost in Alzheimer's, Lyme disease, Crohn's disease, um, invasive cancer, long haulers. So when you're losing these bifidobacteria microbes, you could potentially start a disease and not absorb sugar, not get microbes into your mitochondria, not get your Krebs cycle working, not get your mitochondria working. So in the last month of analyzing stool samples at Biome, we found less than 5% of people have bifidobacteria and less than 1% have lactobacillus or lactococci. So it's really, when you see these microbes disappearing, you have to sound the alarm and say, wait a minute, something's going on, stop what we're doing. Also, when you compare Africa to America, and you see Africa is like 9, 10 phylum are groups of microbes that share one thing in common. And you look at a person that's in a sterile environment in Palm Springs or New York or wherever, um, and you realize that they have 3 phylum. So that right there, the loss of all those microbes is alarming to me. Not only that, but we're coming out with some data showing the before and after, before COVID and after COVID, the lost microbes that we've lost from COVID, that we've lost from what we've done with COVID, the response we've done with COVID has really destroyed the microbiome. And I really feel bad for the kids and the future because we have destroyed the microbiome of humanity. So now we're hitting the cows. Now, I know there's people that are vegan, people that are vegetarian, and people that are carnivores. And it's okay because we all have a different temperament. We all have a different microbiome. Some of us need the meat to survive. We come from generations and generations of family members that ate meat. Others need the vegetables. They come from families generations of generations that ate vegetables. It's fine. So it's not a one diet for all. But here's the problem when you start manipulating the cows, the microbiome of the cows, when you start manipulating the microbiome of the chickens, you start creating disease. I will take you back to 10 years ago. I think it was like 7 to 10 years ago, where the FDA realized that we were giving too many antibiotics to the cows, and unfortunately, that was going into the humans as having C. diff. So here you are eating a hamburger that was given a ton of antibiotics. Technically, that hamburger is going to affect your microbiome. And that's the possibility for increased C. diff at the time. Well, the FDA realized that that was a problem and they stopped that motion. We need to stop playing with our animals. We need to stop playing with the earth. We need to stop putting pesticides on the grass because those cows are eating it. We need to understand why are some cows, catching viruses and or chickens catching viruses and dying and some are not. Maybe and we have the technology now to understand all that, to see the microbiome of the cows, to see the microbiome of the chickens, to understand why are some more resilient than others and what can we do to make the weak cows be stronger. These are the animal studies we should be doing with the ranchers. That's why I stepped into this to basically say, hey, these are my animal studies. Maybe we take the microbiome of the resilient cows and we store that and maybe utilize that in the future for the weak cows. So we don't have to destroy a whole pasture of cows and sheep and goats and whatever else they want to kill. And by the way, where's the animal protective, societies and all this, they're so fast at killing animals that they think are going to infect them when that's not even the case. That those animals would have been fine. Anyways, that's all I have to say. I think we have the technology right now with the raw milk even to know if the raw milk is contaminated with microbes. It's not expensive, it's cheap. You could test it within 24 hours and know that your raw milk has no bacteria, no viruses, no DNA, and basically say, you know what? I can drink it. It's fine. It's not going to kill me. And
Thank
so
you
many
so much.
farmers, by the way, know how to do it well to get the raw milk properly. And we need that raw milk, by the way, for health.
Yeah, thank you so much. Hey, Jason, how's it going? Welcome to the stage. Glad you're here. Come on up.
Yeah, thank you so much. We're in Denver, the National Western Stock Show for all of the Colorado Angus Association events. So it's great to be here in Denver, staying at my daughter's house. So I just wanted to speak to what the doc was talking about as far as exposure and doing it right. We haven't been vaccinating our cattle using any pharmaceuticals for this is the fourth year now, and we have had less sick calves, less sick cattle than we ever did when we were actually using pharmaceuticals on our herd. And because we manage so intensely, both in our intensive rotational grazing, but also in keeping the cows who perform well in our environment and the calves that perform well in our environment, just through natural selection, they continue to get stronger and stronger, better and better. And it's also very evident in the quality of meat that we produce as far as marbling, back fat, and just overall easy doing cattle. And that's because we go back to doing it the way that my grandfather and great grandfather did it before pharmaceuticals, before synthetic fertilizer, when you just had to pay attention to what you were doing. We weren't looking for animal husbandry in a bottle. We weren't looking for a pharmaceutical to treat our poor animal husbandry practices. We actually had to take care of animals the way that they were meant to be taken care of. Otherwise, we would lose the farm. And we've gotten so far away from that because it's just too much work. It's easier to just give everything a shot. It's easier to feed everything in a pen where they're up to their bellies in manure and urine. There's just so much to it that if you actually paid attention, I coined the phrase observational science because I don't necessarily need a liver biopsy. I don't necessarily need a blood panel. I don't necessarily need testing to see if I'm going in the right direction or the wrong direction. And the more people that just pay attention to that and are willing to lead by example, the easier it gets for everyone. So I just wanted to jump in and really reinforce what the doctor was saying because it's so true. I mean, the more exposure we get, the better anti-fragility. I mean, kids that have cats and dogs and bottle feed calves and spend time in the fields and the barns and the manure just don't get sick like the kids that don't have that exposure. And it's the same thing with our livestock. So I just wanted to jump on real quick. Thanks everybody for tuning in. We're doing big things here at the Beef Initiative, and Slim and the whole leadership team have just really been a pleasure to work with. So I just wanted to jump in. Thanks, guys.
Thanks, Jason. Hey, Gary, welcome to the stage. Happy to have you here. And then Dr. Angela will come right to you.
All right.
Yeah, Gary, go ahead. Go ahead.
Oh, okay. This question for Dr. Sabine. I was going to ask her if she would walk us through what happens once we lose our bifidobacteria, the gradual dysbiosis that occurs, and you start losing other bacterial species as well, and it leads into certain things like leaky gut and maybe MCAS.
Yeah, so actually, loss of bifidobacteria, in my opinion, and by the way, this is going off my research that I've been doing. The microbiome research is very new. It's at the beginning, it's in its infancy. That's why, I wrote the book Let's Talk sh.t, because I could be full of it or I can know it. I think I know it, but this is what we're seeing. What I'm seeing is it starts with a loss of bifidobacteria. It starts with loss of bifidobacteria first, and then the other microbes and then other microbes come in because of this good microbe that was supposed to be there to support immunity. It's disappeared. So now other microbes are coming in, other viruses are coming in, and those viruses, those microbes create more damages. The immunity is in the gut because it's really a battle between the good bugs and the bad bugs. And sometimes the bad bugs are actually good guys, and sometimes the good bugs become bad bugs. So it's very difficult to kind of see exactly what's going on at this point, because we still, it's still early in the research. But I would say that looking at diseases, looking at autism, noticing that loss of bifidobacteria is present in autism in majority of kids. Not every kids, obviously. Some kids with autism have a brain primary problem. Some kids have the connection between the brain and the gut might be the problem. Some kids may have a genetic, marker for autism, but some kids we're noticing have a leaky gut and a dysbiosis. And majority of those kids have loss of bifidobacteria at the beginning. We also notice it when we do fecal transplant, and I have an N of one, but Dr. Adams has a lot more cases of kids with fecal transplant that he did fecal transplant, and he used a specific donor. And what he noticed is when he transplanted a microbiome, that the bifidobacteria started reaccumulating after transplant, and the microbiome started changing. The kid went from a loss of diversity to a good diversity, matching the donor, a process we call engraftment. So yeah, the killing of the bifidobacteria, in my opinion, is very fragile. There's a lot of things that kill it. It's not as easy as taking a probiotic, no, because unfortunately that probiotic may not even have bifidobacteria. 16 out of 17 probiotics on the market do not have bifidobacteria on them. The bifidobacteria may be killed in the stomach. It may get caught in the small bowel and open up there rather than going into the colon. Um, and then the other thing is what we've noticed is a lot of them do not even engraft. In other words, you keep taking these bifidobacteria, but then somewhere along the line in the colon, they become dead and they're kind of useless because they're not implanting, they're not engrafting. So it's not easy to regrow what you've lost. I like to give the comparison of a garden. And basically, if you've got all these fruits that are growing beautifully, and then all of a sudden you pour gasoline on your fruits and vegetables, well, you're going to burn the whole garden. It's going to be very difficult to regrow that garden without the seeds of the fruit trees. And as we're going through fires in California, I can tell you, you look at all that land that's all burned down, you need to regrow, you need to rebuild. It's the same thing in the microbiome space. You've killed your whole microbiome, you need to rebuild. And here's the problem, because people can say, well, the easy solution is fecal transplant. No, it's not an easy solution because unfortunately, there's a lack of donors out there that are good, that we feel, qualify. And again, this is the beginning of research because here's the thing, you may swap a microbiome of a person that's bipolar for, you know, for C. diff, for example, right? So we don't know yet, what does a microbiome of bipolar disorder look like? What does a microbiome of, you know, really look like of Alzheimer's? I mean, we have some ideas of progenobiome, but we can't just come out and say, okay, well, you're at risk for Parkinson's because we noticed all these microbes in your gut. As we see more patients, as we see more, the data becomes more and more important to look at. And then we could say, oh, you know what? You want to have a good microbiome to lose weight because we believe that obesity is probably a microbiome dysbiosis. Well, here's your donor, but here's the problem. Your donor may have ABC. then you're making an informed consent. So this is the beginning of research. And this is why I'm here to stop the killing, right? Because don't come to me asking me, and believe me, I have a lot of affluent patients that come to me every day wanting fecal transplant, willing to pay millions of dollars for it. And I tell them the same thing I tell everyone: we're not there yet. I don't want to make your condition worse until we do more research. Of course, if you're so debilitated, you're dying, yes, you're entitled to try everything, in my opinion. But unfortunately, fecal transplant is with the FDA. At this point, we have to go through the FDA for every case that's non-C. diff. So to go back to your question, yeah, there's a loss of diversity that we're seeing. There's a loss of bifidobacteria that we're seeing. And I think it all has to do with what we're doing to the soil and what we're doing to these animals. And I will tell you that during the pandemic, the people that survived COVID and didn't have COVID as much as the rest of the world were the farmers. They knew how. In fact, I spoke at a farm in Virginia, and the farmers laughed at me and said, COVID doesn't exist. You're making it up, Dr. Hazen. You didn't find COVID in the stools. You're making it up. And here's the thing. I said to them, I said, I don't understand. You guys haven't been affected by COVID? They're like, no, you're lying. So you know what? That's my number one thing that I look at. And I tested a lot of the farmers, by the way, tremendous amount of diversity. I had a farmer. There's a video, the farmer and Dr. Hazen on YouTube. They tried to put it down and then we fought and then they put it back up. I think it's back up again. But basically, this farmer was exposed to his wife, who's a teacher, had COVID. He smeared her saliva all over his face. He kissed her, slept in the same bed, did everything. He never got COVID. I tested his microbiome. He had a lot more diversity than she did. Remember, she's a teacher. She's in this classroom. She's not outdoors. He's outdoors shoveling the poop and playing with the animals. And he's got a ton of diversity. And that's what survived him. To this day, he doesn't have COVID, by the way, this farmer. He's my best donor. Anyways,
I've never had COVID either.
okay,
That's
by the
really
way, anybody that has never had COVID, you need to PM me because we're taking the names. And when we have the funds, we're going to be starting to test you guys because your stools might be important in helping other people because, it's a resilient microbiome that we're looking for.
interesting. Well, I will definitely stay in touch with you on that one. Yeah, I never had COVID. I thought that was really interesting. Thank you so much for that, and great question, Gary. Thank you so much, Dr. Angela. Thank you for being here. Welcome, and I can't wait to hear from you.
Hey, thanks so much for having me, guys. And I run a small clinical practice, and from a holistic perspective, functional medicine, digging in for root cause, I've been dealing with GI and immune issues for the past 17 years. And one of the things Dr. Hazen just mentioned about the farmers not getting COVID, unfortunately, they do get Parkinson's at a higher rate. So that is something to watch for. Um, and, we believe that's tied to specifically the chemicals and things that they get exposed to. But towards that end, one of the things that I've been watching with patients over the past 15 years is how glyphosate does affect their diversity of the gut flora. And, Dr. Hazen also mentioned sanitary environments. I actually had a young boy that had a pretty significant inflammatory issue going on in his gut in January of 2020, so much so with blood in his stools and everything else. I told mom we had 10 weeks, and if we didn't see improvements, that we were going to be referring him for a colonoscopy and some other things. It was pretty significant. And then, of course, we all got locked down. But mom was super good about keeping him up on his program, doing everything, and still getting their sample back. It was 12 weeks instead of 10 weeks, and she was super apologetic. But hey, we were in the middle of COVID. And I got his sample, and thankfully, all the infection issues, blood issues, all of that was cleared up. However, his commensal flora was completely devoid, like absolutely not there. And it had been in the first sample. So I was like, hey, Has he been on some antibiotics over the last few weeks? Nope. Has he been sick in the last few weeks? Nope. And I looked at him because we were on a Zoom call in the middle of COVID. And I said, hey, do you have a little bit of an OCD issue with hand sanitizer? And he kind of looked down and he looked back up and he nodded his head. And I looked at mom. She goes, no way. And I said, yes, way. The hand sanitizer both gets absorbed through the skin as well as especially children, they're eating with their hands all day, right? They're going to eat a sandwich or eat their chips or whatever, and their fingers go into their mouth or their fingers touch their food. And he was using it multiple times throughout the day, even being at home because they were locked down with the initial lockdown. So we saw a massive issue with the flora in the gut, specifically the commensal flora that we want to be there, missing. And secondly, when we talk about having trouble repopulating the flora, it can be a huge issue because for decades, many have considered organs in the human body optional. When they get inflamed, just take them out. Well, the appendix is one of those. And it's called like basically call it like the ancient storehouse um, of your healthy flora. So that if you were to get exposed to a stomach flu or something and it wiped out your gut flora, with the right repopulation efforts, your appendix helps restore your gut flora. So it's pretty important and sad because many people have had it removed. When we talk about issues with the gut, we're talking about literally autoimmune, Parkinson's, H. pylori's has become super common and can be very bacterial resistant. But again, it can be something rebalanced back. I'm one of those practitioners, even with diagnoses of SIBO and H. pylori and other in 17 years, we've never done kill, kill, kill protocols. It's always been rebalancing the good flora, the healthy, the commensal flora, as well as getting the bacterial or the more harmful flora down in their population. And lastly, when we watched COVID come through, and again, that was either COVID infections in 2020 or then the vaccinations that started in late 2020 and early 2021, what we saw was a massive uptick in endotoxemia or inflammatory issues of the gut lining and massive issues with decreases in bile acids. And I've only recently learned that bile acids are actually a natural human way of breaking down prions or amyloids, which that's exactly what the spike protein was in the human body, was a prion or an amyloid. So our body was using up our bile acids. And when we have low bile acids, it leads to massive dysbiosis. So that's one of the things that I've been working on in the last 2 years with patients is rebalancing bile acids and helping get their gut flora back in balance, especially with folks who've been vaccinated because their body is still making spike on a regular basis. So I'll leave it there. Thanks, Bree.
Wow, that's incredible. I might need to call you to talk to you about my husband. He's been having some tummy issues lately, but that's incredible. Thank you for that information. Andrea, thank you so much for being here. I'm so glad that you're here. And then Pat, we'll come to you and Gary next. Thanks, Andrea. Go ahead.
No, thank you, Bree. Thank everybody at the Beef Initiative, everybody that's on the space. Great people. You should be following them. If you're not, I have a question for Dr. Hazan here as far as the microbiome. I was born with immune deficiencies when it comes to my gut. And you made a comment in regards to the microbiome has not been studied. I don't understand why it hasn't been studied because I've known about replenishing, which I'm doing right now, by the way, my microbiome. It's difficult for me because certain of the really good foods that you should eat to replenish it, I can't. But I make a point to do so, and I noticed ever since, and this was years ago, that I started studying the microbiome. So the information was out there a long time ago. So it really perplexes me as to why this particular medical area has not been studied further.
So when you say the data's been there a long time ago, what are you talking about? Which data?
No, I don't
Are
want
you
to say
talking
data.
about?
I didn't say data. I'm just in general, and I don't know how
Okay,
I.
so so everybody has a gut feeling, right? That the microbiome, everybody that treats and practices the art of medicine knows that everything begins in the gut. Those of you that are awake and alert, you know that everything begins with nutrition. You followed Hippocrates, and that said everything begins in the gut, and therefore you're going in that path, right? And you're going in the path of the terrain health, and that's how you're going. However, when we talk about science, when we talk about where we are in the microbiome space, we need real data. In other words, we need to say, okay, well, when you talk about loss of immunity, what are you talking about? It's not until recently that we started really seeing the loss of bifidobacteria. In fact, our lab is the one that showed loss of bifidobacteria in COVID, in severe COVID patients versus high risk exposed. Now, that technology is done by whole genome sequencing. That's a technology that just came out about 4 or 5 years ago. Okay, we did not have the ability. In the olden days, when we studied microbes, we would do cultures. Okay, cultures, you miss a lot of microbes. When you look at all the genetic sequencing tests out there, right, and they've been around for a bit now, like 7 or 8 years, there's a lot of microbes that they discover. But here's the thing, do you know what those microbes do? When you look at a stool sample and you see Elistopes fine goldie, what is that? Is that a good bug? Is that a bad bug? Is that a good bug for you? Is that a bad bug for the guy next door? We don't know. We do not have the technology. We do not have the clinical data yet to say. So when I say the microbiome research is at its infancy, that's what I'm talking about. I'm talking about we are seeing something. We knew, those of us who believe in microbiome dysbiosis, leaky gut, we knew there was something there. But the technology was not there to see these microbes in action, to see what these microbes are doing in the environment, to see which microbe is needed when one microbe is overgrown. We didn't have that technology. And the research, nobody's really doing. Is anybody doing? What does turmeric do to the gut microbiome? Well, I'll be telling you what turmeric does to the gut microbiome. Did we ever see a study where vitamin C, we all know by gut feeling, vitamin C is good because we've all used vitamin C during viruses, right? But you didn't really know why vitamin C at a microbiome level was good. Why? Because it increases bifidobacteria. The only study that was out there was an in vitro study where they basically put some bifidobacteria on a petri dish, put some vitamin C inside, grow. But nobody really did the studies to look at what does the microbiome look like before and after to showcase that in humans, the bifidobacteria is improved with vitamin C. So this is what I'm talking about when I say it's at its infancy. Is there's a lot of research that needs to be done to know now that we have, and I'm proud to say Progenibiome has a valid, verified, reproducible assay. I could test my stools today, tomorrow, next month. If I don't change anything in my diet, it's still my signature microbiome. If I take an antibiotics, I'm going to see my microbiome disappear. If ivermectin, I'm going to see, and we showed that data with ivermectin increasing the bifidobacteria within 24 hours. But here's the problem. All these studies are expensive. They start at $50,000 all the way to $250,000. Nobody's spending that kind of money to test turmeric or vitamin C where they cannot make some money. I did because I want to see the truth. I have an extreme thirst for knowledge and I want to have data. And so what I'm talking about is data when I say the microbiome research is not there.
So we need to figure out how to get more funding into this type of research is what it sounds like to me. That sounds like a really important thing to focus on and work on. Hopefully, in this maybe in this even administration, this incoming administration, under hopefully maybe someone like RFK Jr. at the head of HHS. We'll see what happens. Fingers crossed. I want to welcome to the stage Pat. She's had her hand up, and then we'll go to you, Gary, and we'll go from there.
It's so funny when I hear my name, Pat, on spaces. But anyway, thank you so much, and Breeauna, for this invite. And thanks, everyone. Oh my gosh, great, great, great speakers and experts. I love it. I don't ever share this, but I was put in the fibromyalgia category. I deal with a lot of pain. I try to eat foods that are non inflammatory, swim, uh, do different things. It affects my sleep, it affects everything in my life. And the microbiome is something that um, I've been looking at, but I took the probiotics, really didn't see any result from that. So I realized they're probably not a good shelf life product. But moving forward without having uh, the studies and everything done, I live in the medical space. I really haven't had a good solution or kind of a map. Uh, I never got sick as a child. I spent my summers on my grandmother's farm, very organic. I'm in the mud with the pigs, out with the cows, riding horses in the barn, mucking out stalls for the horses, just living on the land, fishing on her property, canning food. Everything we ate was super clean. I never got sick until I went to college. Got sick one in college, and then after that, I started dealing with every time there was a flu, I got it, and just learned to budget it into my life. But as I'm getting older, managing things, and then I was in a pretty severe car wreck, and I had a left to right whiplash in my brain, a lot of brain swell. After that, I have no sleep pattern. I have to take something to sleep, uh, and I fight for that sleep. And I try to eat right. I try to do what I can, but I don't think I'm doing the best job for my microbiome, for the gut. Working with residents a lot, I was seeing C. diff cases. Those to us were unicorns. So to see the increase of that was just insane. But we're overprescribing antibiotics because everybody's trying to get Z-Pak. And after 1 o'clock, the doctors just call it patient fatigue and just give them the script because that's the only reason they came. And I worry about that. But how do we improve our gut? How do we do a better job? Is there a piece of the puzzle here, or is it just trying different things? I'm trying to find solutions. I want to improve the quality of my life.
That's a great question, and that's our next, that we're going to launch right into that next.
Oh, very good, very good.
Yeah, because I have a feeling, now call me crazy here, but I have a sneaking suspicion that it might include something like shaking your rancher's hand and meeting your local cow, being part of nature and engaging right back in with the soil and getting back to nature. So we'll see.
Hmm. Well,
Go ahead, Gary, and then.
I've birthed 8 calves.
Well, that's great. You're welcome here anytime. Go ahead, Gary, and then we'll take it back to that topic.
Yeah. One of the biggest issues, well, I won't say issues, one of the, biggest determination of what happens in the gut is the short chain fatty acid production. I would ask Dr. Hazan if she would, actually Hazen, uh, if she would go over, briefly what happens if you lose your, like the Firmicutes type phylum of bacteria, and you end up, with, you know, not the inability to make butyrate.
Well, first of all, a lot of microbes secrete the same things, right? A lot of microbes secrete short chain fatty acids. A lot of microbes, share different substances that they secrete. Um, It's not something I can really talk about because I like to publish my stuff first. I
Okay.
will tell you, I'm in a pickle right now, and I'm going to say it because my hypothesis on ivermectin was retracted, and my observational study where we basically treated hypoxic patients at home, showing that ivermectin and combination therapy was retracted. So I'm in a battle because the people that are retracting this are, have a conflict of interest. They own patent in the microbiome. And not only that, are playing, are basically investors. Can you imagine a world where we're living as doctors, where you're a clinician, your paper gets reviewed by reviewers that are like you, specialists, gastroenterologists or internists or physicians, MDs, and the paper gets passed through those peer reviewers. By the way, peer reviewers do not get paid for reviewing these papers. For the papers that are non-pharma, they don't get paid. And basically, then the paper goes into the publication for about a year, 3 years, and now it's being retracted by the editor because somebody that's an investor and a PhD complained about the paper. So this is a big problem because it kind of limits me from publishing. And so I've kind of started my own, educating doctors. Anybody that's a physician, a nurse, Angela, very exciting to hear about your work. Would love to work with you with Parkinson's. It sounds like you have a bit of experience on that. That's one of my passion projects, Parkinson's and autism. So, you could join the Biome Squad. We're a league of doctors that basically are trying to understand the microbiome together because we understand its research and we're doing the research together to see all that. So even if it's not published, then we basically talk amongst each other about what we're seeing in the findings. So if you're in the medical field, if you're treating patients, if you're healing, join the Biome Squad. Let's learn together on the microbiome. In time, Gary, I'm happy to, once it's published, but you can always private message me and we can talk about it later on.
That sounds like such a complete conflict of interest, holding back the paper because, yeah, I just,
Well, you have to publish. You have to publish because if it's not published, it's not real. That's it. And I'm not going to be talking about what I'm seeing as a hypothesis without the peer reviewers looking at it. I mean, it's not a conflict of interest if you're basically saying, "Look, I want to make sure that it's being peer reviewed and that I'm right." Right? And the majority
no,
of
I
time.
didn't mean with you. I meant with the funder or whatever, the
Oh, yeah, yeah, yeah. There's,
editor. That's what
yes,
the
yes.
conflict of interest is what
Oh,
I meant
yes,
there.
yes, yes, yes. And I think every paper needs to be published. Everything in the micro. Listen, let me just tell you, 70 to 90% of the data that's out there on the microbiome space is actually flawed. I'm like, these editors of journals actually call me to review their papers on the microbiome because they know I'm going to validate what's on the paper. But here's the thing, why should I validate if I can't even publish myself? I'm not here to tell a scientist that they're right. I'm here to publish because I've done the work to showcase the work. So, it's only fair that it needs to be published. I'm sorry. Everything needs to be published. If 70 to 90% of the data that's in the microbiome space is flawed and it's still out there, and yet they're retracting a hypothesis on ivermectin and an observational study on ivermectin, and we all saw the corruption with the Lancet study and hydroxychloroquine, the BS 96,000 patients that were supposedly treated. Come on. So we're not living in a normal world where we could be, talking about all this because unfortunately, here's the movement that happens in medicine and it happened to a lot of my colleagues. They come out with the data, they write the data, and then some venture capitalist, destroys the reputation and then takes the data, keeps it proprietary, patents it, and then brings it out as a product without giving credit to the doctor that came out with the idea to begin with. So unfortunately, medicine has become all business. You want to talk about why farms, why they're going after your ranch and your farms and your land? They figured out that, colostrum milk has a power. Protein in the milk has a power on immunity, and they want to put that as a pharmaceutical product. That's it.
Wow. That's
It's the same thing with water, by the way. Look at there's people that own rights to water. How criminal is that? That there's rights to water. So wait, so the rest of us that don't have rights to the water are gonna what? Dehydrate because we didn't buy into the rights of water? It's criminal.
it is, yeah. Well, I mean, I have mixed views on that as a rancher and a landowner, but we won't get into that for now. I do take issue with companies like Nestle, for example, buying out municipal waters or water rights for like $1 and then selling, right? There's definitely a limitation to how some of this works, or there should be anyway.
And how you're not even allowed to drill a well, right? I mean, I live in Malibu. A lot of houses have water underneath their properties. And here we are in the middle of a fire. Imagine if you had a well that you could just put a pump on it and start, hosing your house, right? It's what can I tell you? You're not allowed to have drill. You're not allowed to drill in Malibu for a well because they want you to use city water.
Yeah, government intervention is certainly frustrating. Andrea, go ahead, and then we're going to jump into a couple ideas on solutions. And then, before we wrap, I'd really like to host the discussion, the possibility of coming together and what it would take, right, to conceive a new protocol, a new concept, a new sort of way to move forward, and how we might write some policies and better, I would say, best practices guidelines for perhaps this administration, and what we might do, right, moving into the future to change some of these existing regulations, in order to refocus on things like Dr. Hazan's research. And if we are, one of my biggest questions here is, why are we funding public research to begin with if it's not to find ways to make medications more effective and less expensive to begin with? Why are we funding and using public dollars for research if it only benefits large corporations that end up charging us more in the long run for the same, perhaps the same products? Anyways, so just kind of this perhaps a different concept about how we use our public funds and what we can do as a community to guide better practices, regulations, and protocols. So go ahead, Andrea, and then let's have that discussion.
I think this would be a great discussion. I have a question. I don't know if it's for Dr. Cat or anybody else in this room. I target Dr. Cat because of her wide network. But what Dr. Hazin had said as far as the retraction, that's very problematic because science is always changing. Science is always improving. And unless you get that information published, we're not going to move forward as a society. I used to follow the retractions of the published data or the rejections, I would say, up to about 2 years ago. And the amount that are not accepted or retracted was quite alarming, especially during the COVID era when a lot of what they were trying to publish was accurate. So, given that RFK is moving into hopefully being confirmed into the Department of Health and Human Services, what can we do as a community to elevate this concern that we are just talking about right now, not getting medical studies published or being retracted or just being rejected wholeheartedly based on other influences other than what the truth is as far as moving forward with science? What are some of the solutions? Well, first of all, Dr. Cat, do you have pull with anybody that you think will be working with RFK, because this really needs to be addressed. The whole system needs to be revised. Thank you.
Actually, we don't need any kind of pool because RFK Jr. has addressed this, and he did say that there's a corruption in journals. And what has been done during the COVID era, Dr. Hazan is one example of her research being retracted. There are others, and he has said that he will address this. We also have Dr. Jay Bhattacharya going into NIH, where we know he's going to try to bring some sanity and ethics into research. So I think we are positioned in a good place. That said, research that Sabine does is extremely important, and the fact that someone like her, who's been published many times, she has all sorts of research that she's done over the years, never had any retractions until now, really tells you of the corruption of the pharmaceutical companies, because obviously ivermectin, hydroxychloroquine, and that type of research shows that these medicines are available, they're not expensive, and there is a reason why the research is suppressed. But I do have every confidence and know that this is something that RFK Jr. wants to address as he gets in. And before we go
Just
into
my opinion would be to have an independent board outside of the government that has no connections or financial interests in regards to any company would probably be a good start. Thank you.
Dr. Kat, did you have something else to say?
I was going to say, before we go into solutions, we kind of should bring to the beginning of the conversation. We started with One Health. I think everyone needs to recognize that One Health idea has been weaponized because of the fact that they're using it to go after the food source. The One Health approach to climate change adaptation, according to them, may significantly contribute to food security with emphasis on animal source foods, extensive livestock system, particularly ruminant livestock, environmental sanitation, and steps towards regional and global integrated syndromic surveillance and response system. I'm reading this from actually National Library of Medicine publication on climate change and One Health. One Health is an initiative of the World Health Organization through pandemic treaty, but we do have offices of One Health in all the states in the United States and in foreign countries like UK and EU. And essentially, One Health is being used to weaponize the animal industry and the food supply chain. Because if you control the food, you control the population. So it's extremely important to support Beef Initiative and other ranchers around us with what they're doing, because I've recently that one of the states has introduced legislation to let us know if our food has mRNA product in it. And so far, I believe you guys have been successful in not letting it happen in beef industry, although there is some pilot programs. But this is very much happening in pig, right, industry. So, and now with the push of bird flu, the reason bird flu is being pushed so hard is because of zoonotic delivery system, right? They really want to prove that it jumps from animals to humans so that they can introduce this One Health. So we have to recognize that this One Health is a weaponized tactics of the World Health Organization to get control over our food supply, so that we only have so that the government essentially has complete control of our food supply and what's getting on the tables of the families around the United States. That's it,
Yeah,
Breeauna.
absolutely. And just to add on to that really quickly, our livestock industry has been pretty much monopolized through the processing, packing and stockyards, essentially. All right. Through the processing and USDA labeling bottleneck as it is. So it's about 85% of the entire livestock industry that's owned by four multinational corporations. One is JBS out of Brazil, the other is Smithfield out of China. Then we have like Cargill and Tyson, and depending on whether it's chicken, pork, or beef. There's one other corporation that steps up in the cattle industry, but I digress. The point here is that all four of these companies that I just mentioned have massively diversified into lab cultured, lab grown meat. And just at the end of 2023, JBS launched their brand new bio research facility at I'm blanking on where, but it's in Brazil. And for anyone who's not aware, Brazil is one of the number one countries that we import meat from. And why this is important is because in 2020, early 2020, Congress required the USDA and the FDA to sort of split the regulatory burden and determine how lab cultured, lab cultivated meat would not only be allowed to be patented, but then also how it would be regulated, and then how eventually it would be labeled. And so someone was taken out to a steak dinner, probably Tom Vilsack, I'm not going to lie, because what ended up happening is the USDA, for some reason, was allowed to regulate the health aspect of lab cultured, lab cultivated meat. This is quite literally a turbo cancer that is grown in a petri dish, and then additives are put in to make it look and potentially, I don't know, taste or smell like, say, chicken, for example, which the USDA has just approved for sale in the United States. And then almost directly after that, launched a government procurement contract for lab cultivated chicken in the school lunch program. So this is extremely problematic because two reasons. The FSIS, which is the Food and Safety Inspection Service, has yet to return their finalized rule change on how these products will appear in the grocery store. So we have absolutely no idea. I mean, they could very well be in our grocery stores right now, as they've been approved, as we know these corporations are making these products and shipping them out. And Brazil, for example, like I said, is our number one country of import. So these chicken products could very well be in grocery stores today, and they're not required to label them as lab cultured because during the comment process, JBS, and I think it was Tyson, their attorneys argued that requiring them to label lab cultured, lab cultivated meat as such would be an infringement on their First Amendment right, and that it would, and I quote, harm the livestock industry. So we have incredibly powerful lobbies that are extremely influential in the regulatory process. And, when it comes down to it, this is the sort of stated goal, right? Lab cultured, lab cultivated, vertical growing of food, sort of hydroponics, and less land, right? So whether that's sort of subsidizing with insect protein, which we have several manufacturers that have been permitted and are doing that now on U.S. soil, or it's, lab cultured, lab cultivated meat, which all four of the multinationals that pretty much run the livestock industry have not only divested in, but have invested millions into and were given a fast track by the FDA and the USDA to sell those products in US grocery stores. So this is the, long-term stated goal. We know for a fact that entities like the USDA's F&S program, which handles all of the EBT, food stamps, SNAP, WIC, TANF, SNAP programs, right? They've integrated a new AI risk assessment tool, and they, there's a potential to penalize people for eating things like, real milk, real meat, real cheese. real actual food because of the quote unquote climate impacts. So we have this new sort of ideology that's been inserted into the regulatory process, and it is it's the whole sort of stated goal is to impact or alter consumer behavior. So the One Health initiative, tacked on with things like the new ICD 2025 ICD 10 codes, things like Healthy People 2030, they're really taking us off track from everything that we know in terms of consumer choice and a market driven economy where we are allowed to vote with our dollars at the grocery store, right? Because we have this entire regulatory process that's inserting itself and actually economically oppressing freedom of choice for consumers. And so that's all incredibly problematic. But let's see. I see Dr. Angela has her hand up, and then welcome, Maze. Happy you're here. And we'll go to Maze and then Andrea.
Excuse my sarcasm, but for them to have come out with that new, fake chicken initiative while they're in the midst of running around with a another pandemic around bird flu and taking all the chickens out, I don't find that a coincidence. I'm just going to say. And secondly, I'm in full support of the what do they call it? The full fart campaign that's going on in Europe to keep the three nope out of the milk supply. Guys, if you haven't heard about it, it is so worth. They took the full fat concept for milk, full fat. They put an R in parentheses and call it the full fart initiative because the government approved for use in the United States also a chemical that is carcinogenic, potentially um, gene altering, and it's called 3-NOP is the small name for it, the shortened abbreviated name for it, 3-NOP, and they give it to cows in order to reduce their farts. Not kidding, and it's for dairy cows. So yeah, that was kind of my sarcasm to go along with that. And when we're leaning back into what do we do about it, honestly, we have to have consumer labeling. We absolutely, without a doubt, have to be able to maintain consumer labeling and consumer choice. Screw their Green New Deal agendas around our food. That's got to stop. If we choose to eat the way we choose to eat, we can continue to preserve the planet and do things to take care of our earth. But our animals living in congruence with the earth, like, okay, let's get rid of CAFO farming. Sorry, I don't know if any of you guys are CAFO farming. I hope not. But I mean, come on, that is where we're having problems. When you talk about cattle that roam, eat the grass, chickens that roam and eat the grass, like this is how animals are supposed to live. When you take them out of their normal environment and force them into cages to overproduce, yeah, we do have problems then. So let's go ahead and go full out cray cray and get rid of all of the CAFO farming if that's really what they want. But it's not. They just want to control us. So I'll put my mic down for now.
No, those are excellent points. I mean, specifically as the tournament system itself has necessitated the confined animal feeding operation, right? So we have government intervention that's literally created the now problem everybody wants to eradicate, but we can't scale it back. And, it's all due to a lack of processing capacity. So it's like, how do you don't want to scale that back, but,
Well, they create the problem and then
right,
they want to make it our fault.
That's exactly where I was going with that. I mean, such a great point. I had one other thought, but I'll hold on to it for now. Go ahead, Maze.
Are you sure? Because I live for your thoughts, Brienne. As it pertains to this, I swear everybody can use a Brienne in their life. Thanks for the invite. I'd love to know. I guess maybe just to start out, where, what if you have the Green New Deal policies that you specifically went over, or if you guys just talking about it in general. But if there is something that you're sharing, if where I could find it. Um, and also, like, I guess for the most important thing to really fathom here is the fact that this is all like across the board from, like, let's just say the very top level being Agenda 21, which isn't a conspiracy. I mean, there's literally an attempt to kind of preserve, a certain section of the planet under the biodiversity, agenda, the plan for the 21st century. And they just divided it up into 12 goals. And we're familiar with those. We're like, most of us know about the United Nations and the Sustainable Development Goals. And so then what they're doing is, under the guise of like net zero, they're wanting to find ways to, and a lot of these, just kind of in a nutshell, is not just about carbon and sequestering carbon, because eventually they're going to be moving towards really financializing a lot more than that, nature specific. And so when go ahead, Dr. Kat, I'm pretty sure something I said triggered your hand, so I'll yield to you before I continue.
No, I just wanted to say that Agenda 21 and net zero and all of those policies have been reformatted and renamed under Pact for the Future for United Nations. For those of you who are interested in finding out, if you search Pact for the Future, you're going to find all of these documents there.
And then it was implemented. Well, hold on, because I just want to add to that. And then it was implemented in early 2021 by the Biden administration through something called, or what is called the Federal Plan for Equitable Long-Term Recovery and Resilience, or the plan is how it's shortened. Sometimes it's referred to as the Unified Agenda. But you can read all of that in our policy paper, America the Titanic, and fully understand how that has been rolled out through the administrative bureaucracy. Go ahead, Maze.
Thank you so much. And so, there's I would say that like, as it pertains to the United States, and this is something that they're organizing at a global level, and they're working with different countries, and they're kind of coordinating through these different meetings that they have. And I'm sure that most of you are familiar with the World Economic Forum. I feel like that has become so cliche nowadays that I almost hesitate to say it, because people just begin to kind of have a cognitive partition to the recycling bin. But it's very serious. All they're doing is they're connecting this, they're facilitating the path for the corporate fascism that we're seeing take place. And it's important to know that there are different cities that are actually kind of more on an accelerated path, and that just depends on whether or not your mayor signed you up. So if you go to c40cities.org, you can go to this where you live, and you can see if your city is one of those cities. And then what I can post in the comments is, there's like all these different, so with Arup, which is a company that is coordinating on the global strategy around this, they're going to be facilitating the meat and dairy piece, the private ownership of vehicles, and some other pieces. It's a very elaborate topic, and so I'm going to stay in the lane of the food. And I don't know if that's what we're just talking about, the beef and dairy, but I also wanted to give a shout out to Coyote, who's down here. I would definitely bring him up. I think he's piecing a lot of this together and bringing a lot of the America First people on board with understanding what's happening in America. Yeah, I have more. I'll just chime in. I'll yield for now. Thank you.
Awesome. Thank you so much. Yeah, so just really quickly, I remembered what I was going to say when Dr. Angela was talking, which is one point. So Bover, this is really interesting. So Bover is the product that she is referring to, the 3NCO, right? That's the product name, and it's made by a company called Elanco. But what's really fascinating is that the FDA didn't actually approve this product. What they approved the marketing of the product and said, hey, you know what? So long as we don't have any human health issues, and there doesn't, in the future, there doesn't appear to be a connection between your product, and we're not getting too many complaints about it, you can continue to market it. And then what happened 3 days later, Elanco puts out this press release saying, after an extensive, peer review, the FDA found our product safe and effective. Sorry, it just cracks me up because this is how the game is played. All right, go ahead, Andrea.
Thank you again, Bree, for having this space. I just have a few comments. The C40 is real, and people do not realize how widespread it is here in America. They also have two conferences a year on the smart cities. And if you're not following it, you should. Because the last city that I lived in, which was only less than 200,000 people, adopted the smart city concept, but on a county-wide scale, connecting the three neighborhoods, as they called it in the plan. And, um, most people just didn't even realize that it happened. And then people actually participated in it and thought this was a good idea without realizing exactly what it is. So and I don't even remember how far ago, over a couple day period, I decided to research like almost every space on, I mean, not space, but state, on how many smart cities are in your state. They are massive. They are growing quickly. Some of them are already Many of them have already been approved. Some of them are in the planning stage. Even the reddest of states, Florida, for example, has many, many small smart cities. Florida's made up of a lot of small communities and large communities, just like many other states. So I encourage everyone to get involved with their city council planning development meetings, and to fight back all the way. The other thing I wanted to make up, or say this, that is quite interesting to me. I am for limited government. I am for free speech. But there are certain things that our government should provide, and that is the FDA and consumer labeling. That I support if it's accurate, if it's true. So it's quite interesting. I've never heard this before, that a rule was made because one of the major institutions that were going to benefit from whatever the rule change was said it's a free speech issue, and this administration accepted that. That is totally, totally horrendously wrong. I want to know what I'm putting in my body for many reasons, and I'm sure many of you in this space also want to know what you're putting in your body, especially if you have immune deficiencies or immune disease, any of the above or more. It's really imperative that you know what you're putting in your body and what will actually aggravate it or activate cancer. I mean, I'm a two-time cancer survivor. I want to know what I'm eating. This is appalling to me. Thank you. I'm sorry. I just had to get on my soapbox.
Yeah, that's okay. Look, just really quickly. So I know we can keep going after this, but I want to be respectful of the doctors that are on the stage and their time. So, let's finish up by talking about solutions. How can we restore our microbiome, right? What are the things that we can do to help build our immunity naturally? Does it involve, being on a farm? Does it, and how do we access that? Like, how do we build back our natural health? And what are some best practices? What are some ideas for protocols that we could start lobbying HHS for example, as opposed to, biosecurity and locking everything down and sterilizing everything? And then after that, we can open it up and we'll have a broader discussion. But I want to make sure that we're being respectful and prioritizing the very important time of our doctors. So, either of you that want to tackle that, I'd love to hear from you guys.
So this is Sabine's specialty, but before she starts, I just want to say one thing. We absolutely, absolutely have to get rid of the mRNA platform. That's a non-starter, and I know politically it's very difficult for RFK Jr. because there is no appetite in the administration. But until we get rid of the mRNA platform, it's going to be difficult to keep microbiome safe. That's my opinion. But Sabine is the expert, and I defer to her.
Thank you. And thank you for all your work being an advocate on all this. Yeah, I agree. I mean, unfortunately, fortunately or unfortunately, we were the lab that showed that the messenger RNA vaccine kills the bifidobacteria. We tried to show that vaccine injured had zero bifidobacteria, but unfortunately, we're not able to publish that anywhere. I think number one is really stopping, restarting science again and allowing publications again. Even if we have to create our own journal, I know that Peter McCullough is working on that. Um, that's number one. Number two, we have to push for a natural way. We have to push for protection of our animals, our protection of our land, of our fruits. It's when people don't realize when you put pesticides on a fruit tree, you're killing the bees. You're changing the microbiome of the bees. And if you remember, Albert Einstein said, if the bees disappear off the planet, humanity has 4 years to live. I tend to think that if the BIF disappears off the planet, humanity has 4 years to live. And we're seeing that. We're seeing that in the microbiome space. There's not everything is about money. And unfortunately, people, even these billionaires that I see as patients that want to have a new microbiome that I can't offer it to them. So money does not buy you health. We've got to stop the destruction. We've got to educate people on stopping the destruction because the microbiome is essentially like that fire. You're putting water and gasoline on it, you're never going to advance. We've got to heal. We've got to heal as humanity as a whole. We've got to stop thinking that one state, one country is the best. We need to work together because humanity and the planet is all together. The beauty of the planet is the diversity of all races, of all people, people that are vegetarian, vegan, carnivore, you know, African American, Chinese, Asian, that's the beauty of the planet and the diversity in its diversity. Um, Diversity is very important. That's number one. Eat natural foods. Make sure you know your farmer. I was with my sister and we were buying organic, she was looking for the organic sticker. And I said to her, I said, just because it says organic sticker doesn't mean it's really organic. Get to know your farmers, get to know the farms. I bought a whole bunch of bloody orange today and come to find out it's from a farm in Florida. Well, I'm going to be making the phone call tomorrow to say, hey, by the way, are you using pesticides on your fruits and vegetables? That's how you become an informed consumer. So know your farmers, know your farms, know where you get your food, get to use those foods over and over. Test yourself. Unfortunately, the microbiome testing is not there yet, so I don't recommend testing. But definitely test your blood work to check for inflammation, fecal calprotectin, you know, CRP, all sorts of markers to see where you're at. Decrease your stress. I think even me right now with the fires in Ventura and Malibu and LA and having to evacuate my parents and my kid, I have to keep myself in a zone where I say, look, it doesn't help me to be stressed because if my house is burning, I'm not going to change anything in destroying my immunity because of some material things. So don't sweat the material things. Think about every time you get into that stress level, think you're killing microbes. And the key is to rebuild microbes. I used to have arguments with my husband about his closet being dirty. I don't even think about it. I just close the door now. I don't want to argue. Why do I need to kill my bifidobacteria because of my OCD behavior about his closet, right? So I think that's the number one thing. Eat natural, avoid alcohol, drugs. If you're rebuilding, um, you know, avoid coffee in massive consumption. One cup of coffee helps the microbiome, but more than that may kill it. Just more natural. Educate yourself on the microbiome. The book Let's Talk sh.t has some beginning. That's why I wrote it. We talked about bifidobacteria in the book, and I published it before COVID. So that's what I would do. There's a ton of publications that we've done on the Biome website. There's a ton of abstracts we've presented. There's an abstract that was just accepted today on the microbiome and bipolar disorder. You know, thankfully, these abstracts stay and they cannot retract them. So at least that's how we publish. We won 3 awards at the American College of Gastro. So those abstracts are still alive and well and published, and they're on the Biome website. There's videos I've done to educate people. You know, the other hint that I would say is if your diet is Mediterranean from your ancestors, then just stick to that diet. Go back to that diet. You know, I believe that, but that's again, that's my belief. You know, it's not really research or science, but that's how I treat my patients. I tend to go back to the diet that they used to be on. You know, obviously fermented food, sauerkraut, you know, all the right things. And I don't have to, you know, I'm sure Angela will talk more about all that. But I think to me, the most important thing is to decrease the stress, to make sure your vitamin D level is up to par, to make sure you're taking vitamins when you're exposed to people um, with certain viruses, etc. And don't drop your immunity by keeping your mind and body in balance. That's it.
Serene, I really find interesting what you said. Go back to the diet that you grew up on, because I've seen, you know, over my lifetime as well. I'll always go back to Mediterranean diet. Even if I do like a fab for a little bit, I will always go back to what I know, and I feel the best on what I know.
Yeah, I mean, you see it, you know, it's interesting. I had a guy from India who had the worst H. pylori that I had a hard time fixing. And I said, you know what, go back to your food and to the foods you were eating when you were a kid. He went and I said, and try to get some local honey from the area that you were from, right? Anyways, he moved to India for a little bit and restored his gut, and he's back to normal, you know, healthy as can be. And, you know, I really believe it's probably restoring what you started off with. We tend to think of the microbiome as just on its own, but we don't think of the colonic mucosa that accepts these microbes, right? And that's genetically passed on, right? So mom gives us the genetics, but mom also gives the microbes, mom and dad, because dad kid takes care of the kids as well. Some of you who have seen my lectures, you know, I talk about the family microbiome, my family portrait. And it's really that. It's looking at my microbiome, comparing it to my kid who's so similar to me, and then my husband looking like my little one. You know, it's fascinating when you see the signature microbiome within the families, that you realize that, you know, you resemble each other within the microbiome. I mean, my husband and I have been married 31 years. I think we complement each other very well. And we've kind of become the same. Like, I know what he's going to say before he even says it. But even in our microbiome, we're very similar. So, you know, it's the world of the microbiome is fascinating. Who knew? Well, Hippocrates knew.
Thank you so much. Yeah, it looks like my co-host position is kind of glitchy. I'm not seeing people, and it looks like Maze is requesting a mic. I don't know.
There's no hands, and I don't see Maze at all. We have Captain Surf and Turf that's requesting.
Huh,
That's it,
interesting.
but there's no hands.
Yeah, that's interesting. She just sent me a screenshot. So I don't know what's going on. I apologize. The space looks like it's being a little glitchy, but
I think has her hand up
I was
right
gonna
now,
say
and
if the
then
host can like swipe out and then come back in and return, maybe change their VPN location and then return back within a some and then just reconnect.
oh,
That I think it'll work
she's on
out.
stage now. We got her. Thank you, Coyote. Great suggestion. Okay, awesome. Well, if Dr. Cat or Griffiths, I think Dr. Meryl Nass is down in the listener section too a bit, or may still be here. Anyways, if you guys want to close us out with any other ideas, last thoughts, and ideas on like protocols, maybe a different way of sort of tackling our disease model, right? And then we'll open it up and we'll kind of go popcorn style and just have a great chat.
Sure, I'll jump in real quick. I'll circle back around to one of the stories that I shared, and a solution that I would encourage is that we make soap great again. Getting rid of hand sanitizers, they destroy the gut biome, destroy. Make soap great again, just regular soap and water. That's it. Um, even for the classroom, there's portable versions of soap and water that I purchased when I was traveling in Africa. So, it's again, let's not come up with reasons why we can't do it. Let's figure out a way to do it. Um, Eating an anti inflammatory diet, super, super important when we're trying to balance the gut flora and stay healthy. We don't want to be having inflammation in the gastrointestinal tract. Um, Again, improving our bile acids, something I found so critical after COVID and after the vaccine. Again, it affects the diversity of the gut flora, but it also affects our ability to metabolize sugar. It affects our ability to break down fatty acids, so our cholesterol goes up, causes non-alcoholic fatty liver. Like, there's just so many things where bile acids play a role. If you want to learn more about that, I've shared several posts about it. Save them in my oh, what's it called again? The highlights area. So you can just search for acids or bile or whatever, BILE, and it'll pop up. And then lastly, Dr. Hazan already mentioned the fermented foods. Fermented foods can be brilliant, especially if it's something that you are culturally used to. A lot of different cultures use different ferments. If you have not previously used ferments and your body is struggling with a lot of bloating, go slow. You might not be ready for them yet, but also use the feeding a baby bird theory, where if you're going to feed a baby bird, which would be your gut microflora, right? You're wanting to grow healthy flora. If you feed a baby bird, you're only going to feed it a little tiny bit. So maybe you take a couple bites of a ferment the first time, like literally just a small forkful. That's it, right? The first time. And you can build up the amount of toleration that you have for ferments and your gut's ability to digest them and make the appropriate flora and things that it is going to do with all those wonderful foods. So there's lots that we can do, but those are just a couple of thoughts that I would throw in to start.
And
Breeauna.
Oh, go ahead.
Hi.
Oh, go ahead. Go ahead, Meryl.
Thanks.
Please.
I wanted to say a few things. First, people need to realize that glyphosate is actually an antibiotic. It works as a very powerful antibiotic. And so, for some people, if you are, there's going to be glyphosate in virtually every grain that you eat. And there may be glyphosate in corn and other. It doesn't have to be a GMO because glyphosate is also used to desiccate, to dry crops so that they can all be harvested at the same time. So, and it's often not labeled. If you eat organic, it's not supposed to be in there, but of course we know that organic labeling means that things can be sold at a higher price. So the labels may not be accurate. If you buy locally, you're much more likely to really get real organic or grow your own. Growing your own is of course safest. I think that the fatty acids, the medium chain fatty acids in coconut, are perhaps better at feeding the bifido. I'm not sure about that. Maybe Sabine can tell us. But that is, I think, a good fat overall to eat. And you want to avoid most of the seed oils, like if you're eating, basically try to avoid non-organic fats because carcinogens tend to be fat soluble, and you'll find them at higher concentrations as an overall rule of thumb in your fatty foods like butter or the oils you use. Olive oil, maybe not so much. You can, but olive oil is usually adulterated. So most olive oil in the stores is only partly olive oil. So because olive oil was felt to be a health food, and so it became more valuable, and people started mixing it with other cheaper oils. The olive oils from Europe that have a date on them that are usually only good for a year are probably okay, because France and Italy really try to protect their foods because they have a reputation for high quality foods. I also wanted to say that, and of course, your gut bacteria don't determine everything about you. Um, there are also many people who have become, sometimes because of these mRNA vaccines or other things that have happened to them, they've become sensitive to foods. And I found that virtually 80% or more of my fibromyalgia patients, and I had about 1,000 of them altogether over 20 years, would would get somewhat better. Some got completely better when they found out which foods they were eating that they were actually turned out to be sensitive to. So something had sensitized them. It's as if the things in your body that are supposed to figure out what you shouldn't react to and what you should react to in terms of your immune system were not working properly. And we saw this in Gulf War veterans, people with chronic fatigue syndrome, fibromyalgia, environmental illnesses, vaccine injuries, and now with the mRNA injuries, a lot of people are having this problem. And so the way of dealing with it is to do an elimination diet, sometimes several elimination diets, and test foods to see which ones you react adversely to. And you can read about that if you like. In terms of, there are a lot of people who are missing bile acids or stomach acid or enzymes to digest proteins. And now I don't get paid for this, but one brand I found that was very good because it had the enzymes to digest all the proteins, plus it had bile acids, plus it had hydrochloric acid for the stomach. So it had pancreatic substances as well. So most GI
Wait, what was the
problems,
brand? What was
so
the brand?
it's called Digestzymes, and the company is Designs for Health. And it's not that expensive, and you just take one capsule every time you eat. It's over the counter, you can buy it online. I wouldn't buy it online. It's better if you buy it fresh, obviously. But it solved a lot of different gut problems. So it's a good, cheap thing to try first, and it might help. Um,
I'm just going to interject one thing. If you are healthy, please do not do that. It's a big mistake to use digestive enzymes when you're healthy and you have a healthy pancreas. Otherwise, you're going to get yourself into problems. Remember, the body does its own thing of digesting. So, for those who have a disease and you want to try that, no problem. But for those who are healthy, I don't recommend digestive enzymes
right,
because you're
right.
suppressing your
Don't take
ability
anything
to.
if you don't have to, of
Yeah, but
course.
so many people, let me tell you, they listen to this and they think, oh my God, I could be healthier. Like it boggles my mind when the whole probiotic movement came out. I had 13, I was in the car with my daughter and these 13-year-old girls were telling me they were taking probiotics. And I'm like, oh my God, why are you taking probiotics? You're healthy. They're like, well, my mom thinks like it'll make me better.
Mm-hmm.
No, there's no such thing. If you're healthy, keep doing what you're doing. You're doing great. It's only if you have a disease you can try all these things.
Just to be clear, probiotics treat. They're specific to treat different conditions
But
and
here's
they're
the
they're
thing,
strain specific. So if people don't need to be treated, they don't need to be taking it.
but so many, you would be surprised how many people are healthy and think that they're going to get healthier by taking probiotics or by taking digestive enzymes. And half the time I do the elimination diet for patients where I say, okay, let me see all the natural stuff you're taking. And half the time I remove all these things and that's when they get better. And they're like, oh my God, Dr. Hazen, I was taking all this crap. I'm like, yes, that was killing your gut.
Right.
Because here's the other thing, and I'm sure you will agree, the majority of products are not quality tested and they can do more harm to your gut than benefit.
Okay, so this is a problem for all medicines and all supplements, is that 80 to 90% of the ingredients come from overseas. And the countries that make the most of them are India, China, Turkey, Indonesia. And companies here buy these raw materials. Some companies test them, some don't. They can't test for everything. So for instance, there's been lots of scandals about lead in turmeric, and there was lead in calcium pills. Anyway, so then what
Lead in
happens is
vitamins, by the way, and
a
arsenic in
company
vitamins.
labels, yeah, they label the product with their own label, but they've bought the active ingredients from overseas, and you can't even, you call them up. I've tried this. Which country is making your vitamin C? Which country did you buy your X from? And they won't tell you. They don't want you to know. They want you to think it's all American, but very little of it is American. And the same is true for drugs, both brand name and generic, although more of the brand names are made here, but still a minority. FDA does very little testing of this stuff independently. They mainly just look at the test results that the companies give them, which can be faked, and they don't inspect they're supposed to inspect all the factories for drugs. Only this is drugs, licensed drugs, not supplements. They don't really do much with supplements. The supplements are in most cases a completely unregulated industry. But even with drugs, the FDA is supposed to inspect factories every 2 years. Overseas, you're lucky if they inspect them every 10 or 11 years. The FDA didn't even know how many companies there were in China making the drugs until there was a scandal about 15 years ago with heparin, and a bunch of people died. And FDA didn't even have an office in China. I mean, just think of how big China is, 4 times as big as the United States. And they're making all these drugs for us, and FDA didn't have an office there inspecting, thousands of establishments that were producing drugs.
Well, they don't
So
even check.
these,
They don't check the products. Period. They check
Correct.
the label. They check the brochure. They check the clinical trials. Listen, I've been in the clinical trial business for 30 years, and but you ask the FDA, you go, why don't you test the product? They're like, we don't have the manpower, and I agree. Think about the enormous amounts of nutraceuticals that come out every single day. Who's going to monitor all that? It's enormous. I mean, I'll tell you, when I treat my patients, I'm so OCD. I go to the factory of the probiotics that I'm going to use, and I actually tour the probiotic company, and I get to know the owner, and I get to test my patients before and after on the probiotics. Because let me tell you, if you don't do that kind of diligence, you're never gonna know. You're shooting in the dark. My long haulers, my vaccine injured, my Alzheimer's, all these patients, it doesn't help me to put them on my protocol if the vitamins are full of arsenic or if the probiotics are fake and have some contaminants in there, like some other bacteria, right? So it's become very difficult, but at the same time, it's much needed.
Yeah, I think those are excellent points. And I just want to kind of cut in here. So before we discuss any more about nutraceuticals, I'm curious if there's any ideas for perhaps like different. Well, I don't know. I was thinking different policies and protocols, but it might be late in the conversation for that. I don't know. What do you guys think? We've got a bunch of hands. Looks like a lot of people want to chime in. Should we just go to hands and kind of open it up, or should we
I
talk
would go to
about?
hands because
Yeah.
I have to leave.
Okay.
It's kind of, so many things going on right now with all these fires. So go ahead.
Yeah, we're so grateful for your time. Thank you, and prayers for you and your family going through the fires in LA right now. That is absolutely devastating. Our hearts go out to you.
Thank you. Thank you very much.
Yeah, thank you for joining us. We'll go to Gary Coyote and then Shane.
Yeah, I just want to bring up a couple things. If, for people who are vaccine injured, a lot of them, are looking, when they first find out, the first thing is to start grabbing supplements because you hear what people are talking about online. It's probably the worst thing you could do because you have no idea what it's going to do for you. Everybody's different. The thing that I wanted to bring up was, often for the for the gut biome, you hear a lot of people talk about berberine. Well, berberine is a very strong uh, um, antibiotic, so it actually can do more damage than it does good. So that's just one of the things like people don't realize what's going on. They hear things and they're you know realize they find out that they're hurting and that's what they're looking for. I just wanted to bring that sort of thing up so that people are aware that maybe they should be talking to somebody who's qualified before they start grabbing a bunch of supplements off the shelf.
Thank you, Gary. That's a really excellent point. Coyote, go ahead. It looks like we lost Shane. Sorry, Shane. Come back up and go ahead and request it if you got dropped down by accident.
Thank you for having me. This is a fascinating subject. I saw the Texas Slim Foundation right there, and that really made me feel at home right there. I guess I could say I'm a person that I firmly believe that when we have issues, to kind of I try to bring a solution or a possible solution. I'm always thinking about a solution when I bring something to the table, and a lot of this stuff I'm it's great to hear because I didn't know there was this this much stuff, but I guess my suggestion would be becoming involved in a local level in order to start resolving these issues is one of the biggest things. I mean, it could be just from getting in a district seat or going to, starting to go to your, Republican or Democrat headquarters or whatnot of your county, just, city council, just the most basic things of it. And, I appreciate you inviting me here, Maze, and telling me to come because that is something right there because I do hear a lot of issues in a lot of these spaces that we go to, and they sleep on that, they don't understand the importance of that, just the basic local level, because that is the starting point of fixing every problem there is. Even if you want to get rid of something like someone in a particular position, you have to have a replacement right there. So just keep that in mind if you would, because I really wish that more people would become involved locally. Thank you.
Excellent point. I had a great call with I've been working with our legislators here in South Dakota, but I also had a great call with one of our county commissioners where we live. And I was asking her if our county had signed on to any of the recent, federal plan community benefit agreements, which are the contractual agreements to essentially alter land use and zoning and development for the future. And this person told me, absolutely not. We would not do that. And the reason why we have so much money flowing into our local economy here is because people are free and they have the freedom to create GDP and economic, grow their own economic wealth. So it's amazing the difference in mindset, and it's really incredible when you get involved locally and you can work with your local health department, your local lawmakers, and everybody is on the same page, hoping to achieve a similar goal. And, at another point in time, I would like to address, policy related protocols, because I think this concept, like I said, of sterilizing everything, biosecurity, locking everything down, living in a sort of, bubble and labeling everything is an extremely dangerous path forward, which really fully encompasses this whole sort of One Health concept. And we need to get out from underneath it as fast as humanly possible. With that, I'll go to Maze and then Melissa and Captain.
Sorry, thank you. I was in the messages. So yeah, I think that element is very important. That the what I've noticed, I guess, in my time of covering this is that many people at one point, it was just overwhelming to even fathom this. But I think with all of the, all that's happened in the past 4 years, a lot of people are in just various states of awakening, and trying to understand what's going on. And so I think simplification has been my, what I've found more effective is to just, not overdump like information, but more just kind of simplify and show where they connect at the top, kind of, and then being able to show that there's a lot that's involved, but many of these things that we're all fighting in our own silos, whether it's the degeneracy in schools, or whether it's the food piece, or whether it's the corruption that's kind of with the regulatory and the revolving door with medical and healthcare and all that. So, what I wanted to say is that, like, there's a lot of people that really do want to actually participate in fixing this. And that's why Coyote and people that are hosting spaces, they're trying to get people to recruit, like, state by state, like where they go, and they're figuring out how many seats are in each county, and really moving at that level. And so that's why I hope that we can begin networking, because people are literally doing these spaces every day. And we can, if you're interested in that. And also the other piece that I wanted to comment on was the a lot of this, like, is moving by so fast, and I'm just kind of concerned, as we have so many things that we are inundated with, that there's not necessarily a lot of emphasis placed on, just the land, the conservation, the like, people are getting the relocation that you actually posted about, Brienne. I mean, when I saw your post, I was like, holy cow. And so maybe we can prioritize the most urgent. I just don't know if we can kind of brainstorm. Not tonight, not today. I'm just coming up with ideas that I think will help us be more effective. But I appreciate your level of just interest and knowledge and how you break stuff down. But yeah, I'll land there and we can go to the other hands.
Thank you, Maze. I really appreciate that. Melissa, go ahead.
Hi, thanks, Brianna. I'm on the other side of South Dakota from Brianna. I'm in the Black Hills region. I am likely injured from the Gardasil HPV vaccine. I have one medical professional who agrees with me, two who do not. And of course, if the one were to put it in my medical record because of Monument Health being part of Mayo, she would be terminated. When COVID came, I got cancer. And basically, first, what happened was my Gardasil vaccine was officially marked as failing, and I got HPV. And when they took the sample 3 days later, I had a lump in my breast. It was HER2 triple positive, and no genetic markers and no family history of it. I have my suspicions, of course, as to what happened with COVID and everything else. And every 3 weeks at chemo, I would see the waiting room get more full during the vaccine rollout. It was horrendous. And I am also diagnosed with ME, CFS, and fibromyalgia. So I really appreciate Dr. Nass's words. And what Angela was saying about Dr. Angela was saying about the liver and liver issues. I was also hospitalized in liver failure in 2015, and I was having bile problems, I'm sure, but it was also from the gabapentin that they were giving the patients. My liver was 30 pounds overweight. I've been on my own a lot and repairing myself a little bit at a time, researching on my own due to where I live and lack of resources. And I think I'm doing pretty good, all things considered, but I'm still healing. And to me, it's very important that we fix the issue not just with us, the humans, with our gut biome, with the livers, cut down on the chronic illness and disease, look at the vaccines, but also look at the animals. My grandpa was a rancher and he was healthy and he lived a really long time. In fact, he had cows until he was 94 when we told him, okay, you're getting too old, no more cows, you know? And so I've been trying to make it a habit of coming when I see Brianna and listening and sharing this with all my ranching family and friends West River. I have quite a few of them in hopes that they will get on board so that we can help fix this problem on our own local level. And I just want to tell you guys, I really appreciate that you're all collaborating together. because I do feel it's important. We got to worry about the biome. We got to worry about the chronic illness. We got to worry about the liver. And if our meat is contaminated or is not doing well because of everything we've been using in, the fields and putting on our food and what we're giving them, that's not going to do us any good. So I just wanted to say how much I appreciate what you guys are all doing. And I'm trying to do what little bit I can on my end. Thank you very much.
Thank you, Melissa. And we appreciate you too. Go ahead, Captain. Welcome to the stage.
All right, thank you. Thanks for having me up. And Dr. Kat, un piacere conoscerti. Practice my Italian whenever I can. But thank you for guys for having me up.
Grazie mille.
Yeah, thank you. One of my questions, going back to the COVID-19 and the whole pandemic, was a lot of people gloss over this. Coming from a background of being a former drug rep with a big pharma company, I appreciate this type of level is the PCR test and how it was used as a gateway to get people to buy into this whole COVID-19 bullshit. The PCR test, Kerry Mullis invented it. It was not specifically being used, meant to be used for virology testing, especially on this level. There's an amplification. I don't want to get into too much clinical detail. You doctors can understand this, what I'm talking about, but I'd like to get your opinions on this of like, if we are to have a test to test for virology and a so-called COVID flu test, what would you recommend? And as well as your thoughts on the misuse of the PCR test. I yield.
It was never meant to diagnose disease. So it never should have been used in asymptomatic people, period. They went looking for things. And then to the point that you said,
Amen.
when you overcycle the test, you can make positives out of nothing. You can make positives, which is why the false positive rate was so very high.
Yeah, this is a point of contention that I've had for quite some time, and I've wondered there has to be better methods of testing, and that's exactly what I'm talking about in terms of protocol and policy. Is there? I mean, would you guys recommend a different type of test? And how do we get there? How do we get there faster? How do we prioritize? Making sure that there's actually a virologic, if I'm saying that correctly, jump like for example with H5N1, I find it incredibly problematic that it's being it's being used at a 40 cycle threshold to test milk from dairy cows, for example. But they
So they're
haven't.
overcycling again. They're
Right,
looking for it as
right.
opposed to looking at animals who are showing symptoms or they've stopped producing or some type of a clinical sign that they're not doing well. Then there would be a reason to test an animal with a normal cycle threshold. But don't go looking for it. That's ridiculous.
Well, and 2 points on that just really quickly. So we have entire herds that are PCR negative even at that 40 cycle threshold that have yet to be released from quarantine. And so here's the other part of that, which is, like with Mark McAfee, they sent off the milk samples that had originally come back positive at that 40 cycle threshold, and they sent it off for an egg broth culture, which was to determine if there was actually any viable sequences within that sample, right? And
Viruses, yeah.
yeah, which means
Can it
what they
grow?
found in
Yeah.
what
Can
they
it
found
cause
in that
infection?
sample. Can it actually cause infection? Yeah. And they never released those test results to him. The state of California, that is, excuse me. So not only are we having test results withheld by centralized, national veterinary lab network, but then when herds are coming back as being negative on PCR, they're not being released, and that just seems like a bit of overkill, if you ask me.
It's
So,
shisty. They're kidnapping your
yeah,
animals.
this is Meryl. Let me just say that this is not about that the test is wrong. This is about that there's a political policy and that they are using these tests in ways to support their policies. So the problem I mean, there's a value in PCR tests when they're done correctly and you know how to interpret them. But they haven't been done correctly for COVID, and they aren't being done correctly for bird flu because the government wants cases, and so they're desperately looking for cases, and it's been very hard for them to grow the virus. And I'm not even sure if they do it at the level of the state. They may only do it at the FDA or the USDA labs. There are at least a couple of months ago, there were only 3 labs in the country that were confirming bird flu cases. So they could do a PCR test, and if they got a positive, they were supposed to send it off for a second test. And then if it was in a person, they were supposed to send it off for a third test and really make sure that they got the diagnosis right. So you may remember they said that there was a child in California with bird flu. That was a test at the level of the county. The state repeated a test, said no, the kid was negative, but they didn't want to let it go. So they kept it in the media. Finally, they did a third test at the CDC or FDA, and they said, no, it's not bird flu, it's some other kind of influenza. Now, so they're testing people for just regular influenza A first. And in the case of this child, because the family drank raw milk, that was the narrative that they wanted to spread. Child drinks raw milk, gets very sick from the raw milk, and has bird flu. Well, they had to let it go. But how many people heard a week later that the child tested negative? And how many, it was big news in the media when they claimed she was positive with just a really crummy test. So let me just repeat that it's not the test that's at fault, it's the political policy that is driving what tests are being done and how they're being interpreted. And until we have, governments that are actually responsive to the people and not to a few select special interests, we're not going to be able to solve this problem. And we have to hope that in 6 days, when Trump comes in, that we're going to have a whole bunch of new people, and hopefully we're going to be able to get something done about this.
Dr. Mary, I definitely appreciate what you said, and I agree with a lot or most. I just will say that the actual inventor of the test, Carrie Mullis, actually said
Look,
it.
believe me, I know all about the PCR test.
And
I
the
don't need to hear that.
overamplification of false
Yeah, no,
positives.
but
Yeah, you got it. You get it. I
I
get you.
believe me, I
I
really know
yield,
a lot.
doctor. Hey, former drug rep. I'm yielding you to your
Okay,
expert opinion.
I edited the citizen petition claiming that the PCR test was done incorrectly that was sent to FDA before they rolled out the vaccines. It was written by Sinhang Lee, who has a PCR and a sequencing lab in Connecticut, and I was his editor. So I know a lot about this, and the PCR test. See, it's very hard to grow viruses and expensive. So you have to do a cheaper test at first to look for things, and a screening test. And PCR has become the screening test. And then if you really want to confirm it, you have to do other tests. You also have to use the right reagents. You have to use the right cycle threshold. There are studies that have been published that showed for PCR tests for COVID, you could get many orders of magnitude different. If you tested the same person and you did it with 2 different labs or with 2 different reagents, the FDA actually gave EUAs to almost 300 different PCR tests for COVID.
Yeah,
And some of those were being
go ahead.
produced by Chinese illegal labs here in the United States,
Yeah,
in
some of them were
California.
produced in China, but they used different primers, different probes. I was calling some of the big companies at the time, I mean back in 2020, and saying what primer, what probe, what are your reagents? Because I had learned that those were important working with Sinheng Li, and they wouldn't tell you. So the FDA just basically said, let her rip. They did not compare the one test to the other. They offered a voluntary test. If you wanted, you could do a test where the FDA would send you samples and you'd run them on your PCR, and then you'd give the results back to the FDA, and they'd tell you whether you were right or not. but it was voluntary and only a relatively few companies did that with their tests. So you have no idea when you go in for a PCR test, whether the technician knows what they're doing, which machine they're doing it on, which cassette they're using. As I said, it could be one of hundreds, and what reagents and the whole bit. So it's crazy, and the government doesn't want us to be aware of these things. But at the same time, I mean, PCR can be very, very valuable if you were dealing, I'm an anthrax expert, if you were dealing with a sudden onset of people getting anthrax, you could do a PCR test, and within a relatively few hours, you could find out with a high probability that you're right, whether it's anthrax by doing that. And if you tried to grow it in a lab, it would take several days. So I just don't throw away the baby with the bathwater. It's really bad public health, bad government that has been
But
misusing these tests.
Dr. Merrill,
I appreciate.
how do we ever trust the system to run them properly again?
Well, hopefully, I mean, if Bobby Kennedy gets in there and he has the right advisors, then these are all things that are not that hard to fix. You just stop paying for you stop allowing reimbursements for tests that haven't proven themselves or for ways of using them that are wrong. And as soon as the labs don't get paid, they will stop using the tests or they'll use them correctly. The CDC directed these labs to do the tests wrong. They told them use a cycle threshold of 40, which is
That
ridiculous.
was
Okay.
Dr. Fauci. Yep.
No, that was CDC. I mean, I don't know if Fauci told CDC to do it, but I read the CDC guidance that said that. And FDA gave out EUAs, which meant we're not responsible. We haven't checked your test. We're giving you an EUA because, we're in an emergency situation. So just run your tests and call it good. So, we can't have that anymore. The agents, now that the what's it called? Chevron deference is gone. The Supreme Court had said previously, basically, that the agencies, the federal agencies, would have deference when it came to arguments about technical arguments like the science. So, for example, when I was involved in the case, I worked with people who got the license removed for anthrax vaccine back 20 years ago. And the government appealed, and when we went to appeal, we made our arguments, and the first judge, listened to our arguments. The second judge said, no, FDA has deference because of this legal doctrine that's just been overturned last summer. She said, we're not going to listen to your scientific arguments about the anthrax vaccine. The FDA has the right to make these decisions, even if it goes against all their rules and regulations. And so FDA wins. We're throwing the case out, basically, or we're throwing our point of view out. So that's what happened for 40 years. We had judges doing that. And now the Supreme Court has told them not to, that the agencies don't necessarily have deference. So all of these rules and regulations that have been rolled out by federal agencies when they thought they were safe are now open to being reinterpreted. And if we have the right people in the agencies say, look, well, what have they done over the last 5 or 10 years? What rule, or more than that, which rules and regulations have they rolled out that maybe weren't a good idea? We don't need Congress to pass a law. We can just change them at the level of the agency. It's a much quicker way to get something done. And, we desperately are hoping that the Secretary of Agriculture is going to be on our side. Her name is Brooke Rollins, and nobody knows a thing about her because since she lived on a farm as a child, she doesn't, and got a degree in agriculture in college, but then she got a law degree and she had nothing to do with agriculture. And now it's 30 years later, and she's going to be the Secretary of Agriculture. And we desperately want to get to her and talk to her about our issues. But nobody knows who is going to be whispering in her ear and whether it's going to be, big ag, big chemical, big pesticide.
So we're not going to get Thomas Massey and Joel Salatin. That sucks.
So you're not getting Thomas Massey as the secretary because she's been nominated. She was nominated a couple of months ago. Joel Salatin was only interested in a part-time advisory position, and we don't know whether he will be
I got you.
asked to do that.
Hey, thank you. I really appreciate your open and thorough, frank opinion on the PCR test and all about that. And I agree with you. I mean, there's some merits to the PCR test. That's why it was invented. I just was noting that the inventor of it, literally said it wasn't meant. It could be misused. There's margins of error with the
Absolutely.
overamplification.
There's
Yeah,
a
yeah,
lot of
you
issues.
get it.
It's not
I
straightforward.
appreciate you getting that because I'm so used to talking to some doctors on that are just worried about. I'm going to be honest with you about keeping their state licenses, and they don't want to talk. They push the vaccine on people without even true scrutiny. Yeah, I yield there.
Right. Yes, I am unlicensed as a result of all this, but it's okay.
I literally had doctors that I called on and I questioned them about that. And they said, my first name, and they said, listen, I'm in the Northeast and like, I want to keep my license for next year. And I literally, I just shook my head because I just thought it is, I'm sorry. I'm somebody who lost my job in a career because I would not get the vaccine because I worked within big pharma. I was not going to do that. I was not going to yield to my principles. Here I was trained by big pharma to read clinical studies and use it to my expertise, and they still wanted me to get the clock shot. So yeah, I yield.
Yeah, these are
Yeah.
the problematic. Oh, sorry, Dr. Hazan, go ahead.
No, I was going to say, but not everybody is the same, right? And I think we have to respect those that are not as courageous to give up their career and give up their license. And listen, having seen both sides during the pandemic and having seen my friends, one of my friend, Dr. Jackie Stone, supposedly killed herself, and who's taking care of her kids? She did the right thing by saving lives, but at the end of the day, she's not here to take care of her kids. And at the end of the day, when you lose your license, you're really not really good. Yes, you can speak about all this, but it'd be better to like have a license to keep helping people and helping some on other things than COVID, right? So, I mean, imagine a world where we just say, you know what, the doctors were all, unethical and they didn't treat, and therefore we should get rid of all the surgeons. Well, who's going to take care of an appendicitis in the middle of the night? I think we have to respect those doctors who, you know, didn't have the courage. And I think we need people like me, Kat, those doctors that had the courage need to set an example to the other doctors, and we need to encourage them. We can't continue beating them up. I think we need to bring back our doctors to be artists in medicine again, and to realize that's what they went into medicine for, the art of medicine. Um, and really that's my role. My role is to bring those doctors that didn't have the courage and give them courage. And I think we all need to do that, especially in the new era. We need doctors.
Well,
Absolutely, Dr. Marilyn. I meant no disrespect there. And what I raised in terms of my challenging was during the height of the COVID, where there was so much confusion and contention and just so much heat of like, you're scratching your head like, how the hell can this be? So yeah, but I
Yes,
understand what you're
right.
saying for the long run.
I was scratching my head too, believe me.
I think we all were, right? I mean, I think, those of us, and listen, there's a lot of doctors that are not vocal, but that did the right thing and that were silent about it, right? Because they didn't want to lose their license, right? But they didn't speak about it, but they still
Hmm.
did the right thing. I think what we're going to see a change. I think this, woke up a lot of people. My whole community. I lost my privileges during the pandemic. Because I wouldn't follow the narrative, and I was actually challenging the narrative. And actually, when people asked me, like you, by the way, I come from a pharma, having done clinical trials for pharma. And someone said, well, how come you didn't just line up and take the shot? I said, frankly, I don't trust pharma. That's why I do clinical trials, to see the data myself. That's why I go to a probiotic company and analyze the probiotics. I don't trust. And at the end of the day, it's my body, and I got to make sure that I'm doing the right thing for my body. And even if I don't do the right thing, it's ultimately my choice, freedom of choice. That's what I'm pushing for. um, it's a tough situation for the doctors. You all probably saw the whole testimony on Joe Rogan of Mel Gibson when he was talking about his three friends that had terminal cancer. And actually, I know one of the patients, and in fact, it is true. Uh, and I actually collected the stools before and after. But here's the thing, this patient got everything. Okay. So, ivermectin, fenbendazole, you name it, he got it. At the end of the day, you have to kind of say, okay,
Did he get
well,
any pharmaceutical immunotherapy as well?
oh,
I'm
yeah, he
curious.
got
Like
everything.
a Keytruda or something
Yeah,
like that?
yeah, he got everything. He got everything, this guy. So the question then becomes, and now he's in remission. Okay. But here's the thing. But by the way, Keytruda done great for some patients, but then doesn't last, right? So it's all science, it's all research, it's all what we're seeing. How many doctors are going to jump up and say, "Let's give ivermectin and fenbendazole," right? They're not, because there's no data. Nobody's writing the data. Even if I tell you tonight, listen, one of the patients, I know him, it doesn't mean anything until it's written and it's valid. It's been verified by a peer review that it's real by a regulatory board, and that somebody else reproduced it. That one doctor is treating with one protocol means nothing. And I'm being as objective as possible as a physician. Even if I tell you, when I tell you loss of bifidobacteria in autism, I said that because I also saw it in Dr. Adams' study. The fact that his study validates my study. All research needs to be valid, verified, and reproducible. Until we have reproducibility, and it might take a long time to get these doctors to have reproducibility. Listen, the first time that somebody did fecal transplant on a patient for C. diff was Dr. Einsman in the 50s, okay? And he did two enemas on patients with C. diff, and he saw they improved. But it didn't take until like Dr. Barodi in the 80s started doing a lot of fecal transplant, and then he published a lot, and then other doctors started paying attention. And myself, it wasn't until one of my patients was dying, you know, a couple decades ago, that I called my friend Neil Stoneman. I said, "How do you do this fecal transplant? Because my patient's dying. Let me try everything." And I did it, and he improved. And that was reproducibility. And that's how we advance science. And now, guess what? Fecal transplant for C. diff is part of the guidelines. But we need to do all these steps to get to the guidelines. And yes, all of us who say something now on ivermectin and fenbendazole or ivermectin increasing bifidobacteria, we're looked upon as we're the biggest fruitcakes ever. But guess what? Eventually it's going to be validated, it's going to be reproducible. I think that's the importance of research. So we need to hold the hands of all these doctors. I understand. I'm a cowgirl, so that's probably why I'm involved with the ranchers. I'm out there. Like if everybody's going to the right, I'm going as far left as possible just to avoid everybody and to find the shortcut to the mountain. But not everybody's like that, right? So, anyways, I'm sorry to have interjected. I feel it's an important, we need to bring back our doctors.
I actually agree with you, Sabine. A lot of times I'll go into spaces and there is, I get the anger, I get the lack of trust, I get all that. But, I feel exactly like you. There are many colleagues who have done the right thing. They were not in a place to speak out. There are some that are still not getting it. And I feel that our job is to really restore trust in medicine, but I'll also reach out to our doctors and kind of bring them to this new life, new reality of where we are. Because, you can talk about making America healthy again, and talk about Fruit Loops and all that, but there's a lot of things happening in this world, and every new vaccine that's coming up is going to be on mRNA platform, and we need to open the eyes of our colleagues to see that damage has been done, is going to continue going on unless we address some of these major issues. So thank you for saying that. I think it's really important.
Yeah, and thank you for supporting. I mean, listen, not, so many doctors. I mean, look at Mary still fighting for her license. Look at Peter McCullough lost his boards, Pierre Corey. I mean, Paul Merrick. I mean, those poor guys, they did the right thing, but look at where they're at now. It's a shame. It's a shame. And unfortunately, they're role models of of not going against the narrative. You know what I mean? It's only a few of us are still frankly standing. But I think we definitely need them back. We need to
Well,
convince them. And we need to
they
convince
certainly
the doctors to support RFK. That's what we need too.
Yeah, they turned him into a warning to every other doctor, right? They made an example out of him, and we're having the same thing within the ranching community. So honestly, in order to preserve individualism and consumer choice, there is definitely a clear role that each of us plays, right? And there's an importance for this connection. We have been in here though for 3 hours, and I want to be respectful of your guys' time, and I have to hit the hay soon here. It's 11 o'clock Central Time, but I just want to say, each and every one of you are so incredibly important. We're so grateful for all of your time and your sacrifices, and if it wasn't for people like Dr. Meryl Nass or you know, well, I won't go into the full list, but if it weren't for those doctors, right, during COVID-19, I don't think we would have had the kind of challenge that we did. We wouldn't have had the kind of patient advocacy that we saw, and perhaps we would still be in lockdown. I don't know. The Great Barrington Declaration was incredibly important, but we're seeing this. Very similar to in other authoritarian regimes, we're seeing this sort of exodus in academia, this sort of ideological priority taking root and taking a role of importance over the scientific method and freedom of thought, for example, new concepts. There's this definitely a coercive nature to following and getting in line and sort of just going along in lockstep, and I think that is among everything, right? That is the thing that unites us, is our desire to see individualism protected within our country, because that is really what makes a free society, is the ability to be an individual and not just a cog in the collective. So I appreciate every single one of you. We're so grateful that you guys joined us tonight. We hope that our audience was able to get some important information out of this, and just know that we're tired, but we are fighting so hard and so diligently to change these policies that have created such a hostile environment towards things that make sense, actual evidence-based medicine, for example, being chief among them. But just the connection between the microbiome and and the rapid rate of which we're losing our farms. There's got to be a connection, or there probably is likely a connection between the rate at which we're losing our microbiome and we're losing the family farm. And I think it is this lack of connection with nature and our lack of getting, we need to get back to the source of the seed, as Texas Slim likes to say. And we can all begin that transformative process by starting at the first step, which is shaking your rancher's hand. So we highly encourage you guys to check out our beef maps. Go online, find your local rancher, get to know them, know your cow, right? Engage in the process, either buy a quarter, a half, a whole, animal, buy 5 chickens and enter into a herd share where your local farmer raises them for you, and you get to go check up on them and see how they're doing and become part of that process of living a more intentional life and taking responsibility and self-custodying your own health care. And so these are all of the things that we are working and collaborating towards, and we thank each and every one of you for being part of that collaborative process.
Yeah, thank you so much, Breeauna. Thank you all for joining us. Dr. Kat Lindley, Dr. Griffith, Dr. Meryl Nass, and of course, Dr. Sabine Hazan. Your work is tremendously important. It adds a tremendous amount of value to the beef industry, to the beef initiative. We're not just out here slanging steaks, right? Um, we are up against the entire world. Farmers and ranchers are among the highest rates of suicide in this country. We're losing about 140,000 family farms every 5 years. You'll see up in the notes above a couple posts I want to bring to your attention. The first one is, of course, IamTexasSlim.org. We could not do any of this without the support from our community. We don't have corporate backers. We are not part of the One Health initiative. We are forging our own way here, and we are made up of farmers and ranchers, policy partners, and advocates, right? So please visit IamTexasSlim.org. Make a donation today. We have a new website launching, hopefully in February. We have a big campaign running right now. It's called SaveBeef.org. You can see up in the post that I made that up until recently, beef.com was owned by PETA. They took over the website in 2004. So 20 years has gone by. I think I did the math a little bit. It's late. It's about midnight where I am. But we have lost about 700,000 family farms, a lot of them beef producers, since PETA has taken over beef.com. So I want to encourage you all to join us on this next leg of our journey in creating a truly decentralized food system, health system, and medical system where we are informed by our local biomes, by the cow's biome, by everything that is good and pure in this world that we are fighting for. So you can help us with donations at IamTexasSlim.org. Visit SaveBeef.org, sign that NDA. Don't be scared now, okay? Sign that NDA. Join us in the next leg of this journey. If we lose this thing, well, maybe PETA will get it again, right? So let's make sure that doesn't happen and we control the narrative of what beef is for